Good morning. It's early. Hope you all have coffee. Welcome to our training today. Another one with the awesome Tricia Miller on policy development this time. I just sent out an email, so keep your eyes open. It's got some handouts and some useful stuff for today if you didn't get it from before. So check that. Otherwise, thanks for being here. As always, we're Montana Public Health Training Center. We have quite a few trainings coming up. So again, I always encourage people to check our website out and see what's next on the docket. But for today, that's all I have. So as always, use the chat box if you have questions. We'll be monitoring it the whole time. And certainly if you have any technical difficulties or anything like that, that's what I'm here for. And with that, Trish, I'll turn it over to you.
Okay, great. Let me try to share the screen, and does that work? Emily, did that work?
Looks good.
Okay. All right. So good morning. I know like she said, it's early. It's earlier here for me. I'm in California this morning, so I'm an hour behind you. So that just means I get done an hour before you. So that works out great. So welcome to this Public Health Policy Development webinar. So this is going to be fun. For those of you who read the bio, you can see that I teach at the University of Montana. I do those online classes for the graduate for the public health. I also teach here in California. I've been lucky to be able to work in a bunch of different disciplines over the course of time. My training is actually in political science and policy. So it's been really fun for me the last few years to be able to actually mesh my public policy background with public health. And so that's how I am here today, because public health and policy go hand in hand, and public health policy is super important. So what are we going to talk about today? We are going to talk about the policy process, right? Just a basic understanding. Part one is relatively quick, but we're going to just make sure that everybody's on the same page and sort of understands how the cycle is supposed to work. Of course, all good models have to be taken with a grain of salt, because that's not always the way it works. In part two, we're going to talk about public health law and how it is that we have the authority to make public health policy, and what are the differences between our various levels of government, and how do we get policy that is good public policy that helps the greatest amount of people. And then part three, we're going to talk, since we learned all these other things, we know why, but how? How do we actually go about getting that policy passed and getting it through? So hopefully you'll get some good information today. Here's what we want to learn by the end of our webinar today. We should be able to describe the stages of the policy process and identify the steps in policy development. We want to be able to classify different policy options using the intervention ladder, which I hope you'll find is a useful tool moving forward and starting to think about where the policies that you deal with are on that intervention ladder and where you might go next. We want to recognize important steps to take to engage stakeholders. That can be a difficult part for most people. Utilizing tips towards building momentum. And then we want to be able to outline a couple public health issues using Schneider and Ingram's social construction table. We're going to talk about benefits and burdens and how that happens when we create policy. So we have a couple case studies today. So that hopefully will be a little bit more fun. You won't have to spend the whole time listening to me talk. We've got a few polls out there, which, as I mentioned to Emily, are basically pop quizzes. So hopefully you're paying attention and ready to go when we throw those polls at you. Maybe keep everybody a little bit more awake this morning. Okay, so if there's no questions before we get started, I want to go ahead here and just talk a little bit about the policy process. So this graphic comes from the CDC, and actually much of the information I'm taking today is from the CDC on this policy process. If you study the policy process from a political science standpoint versus a public health standpoint versus sociology, everybody has just a little bit different take on how they look at the policy process. So I'm using this graphic purposely today because I know you guys will have access to all that. I also included it in your handouts. You have several things in your handouts from today, just so you don't have to go looking for these things later. But this is really good, and for the most part is about what we look at when we're talking even in politics. So if we look at the policy process this way, notice there are actually 6 stages here to the policy process. There are only 5 numbered here. And the reason that is because, see, if you look in the middle there, that evaluation goes all the way around. And that's because there are different types of evaluation. And sometimes we evaluate at the end, which is sort of where we put it in political science, at the very end. But you can do formative evaluations and process evaluations along the way. So this graphic actually shows it is going all the way around. The other big important part of this is that in that middle center, notice how important that stakeholder engagement and education are, right? That's the centerpiece of what you're able to do. So we can't underestimate at all the importance of those stakeholders, right? So we're going to talk about stakeholders. It's going to come up time and time again this morning. We're going to stakeholder you right out. But we want to look at this because, and the reason I want to cover the policy process is because most of you that are working in public health really are focusing in 4 and 5, right? 4, 5, and 6, I should say. You're enacting the policy, but really on this graphic, you're in what I would call 5, and then the 6 that's not numbered. You guys are really at the heart of implementing policies that other people have created. And then a lot of times I'm sure you're required to do the evaluation component to go with it, even if it's just a report about your program or your policy, those kind of things. So what I find is that a lot of my public health people are really just working in the implementation and evaluation stages, okay? The problem with that is that the people making the public health policy are not necessarily experts in public health, right? So my goal every time I have an opportunity is to convince all of you in public health that it's super important for you to get involved in those first 4 stages, right? Because we can't get good public health policy if we don't have people who understand public health that are actually willing to get in there and jump in that front 4 pieces of that. So we want to talk about what those actual pieces are today so you can start to see where you might be able to plug in. Because again, I think it's very important that you guys recognize that you're being given policies, and I know some of you have thought, why in the world would they do it this way, right? Well, most of the time it's because those politicians, those policymakers don't necessarily understand public health. And so I think it's very important for us to learn how to plug into that so that we know we get much better public health policy if we have public health professionals working on it. And of course, all of you are going to say, but I don't know how to do that. Well, you're here today, so hopefully you will have a better understanding of just how to do that once we get moving. So let's go ahead and talk about each one of these steps separately. So we'll start with number 1, problem identification. And problem identification consists of 3 different things. First, we want to clearly identify the root cause of the problem, right? And this seems so simple, but realistically, we can just have an issue going on, and if we're not really careful, we may not identify the actual root cause of the problem, and then we start to go after, we create a policy that actually works somewhere else within that problem and doesn't actually go after the root cause. So we'll see sort of how that works as we go through the different sections today. The second piece of this is they want to develop a detailed problem statement that includes the problem's effect on a population's health. So what is the problem and what are we going to be doing? What are we trying to do to help the population as a whole for this particular issue? And of course, as I said already, don't forget stakeholders, right? Very important in the problem identification stage. This is really, we get to, and we'll talk about how we define that problem later, but really this problem ID is recognizing that something exists that needs an intervention of some sort, right? So that's really what we're talking about, and how we define that and how we include people in that process is going to make it either easier or more difficult when it comes time to actually create that policy, okay? So why is it important in this stage, right? So like I said, you want to really make sure you're identifying that true underlying problem causing the public health issue, and there might just be various parts. So here's an example. If we say the issue is homelessness, right? So, you know, every place in the country has some sort of homeless population, right? Some places are greater than others. Here in LA County, there are 66,000 homeless. So that's a huge issue here, not necessarily as big an issue someplace else, but it's still an issue. But is it really the problem? Is homelessness actually the problem? No, because we have to go back and think about what are the root causes of homelessness, right? And this is where you need to identify in your particular community. So maybe it's economics. Maybe there's a whole bunch of people who have just lost their jobs and who now don't have housing. Maybe it's mental health. Maybe it's drug use. Maybe there are veterans with issues. Maybe it's all of these, right? And it depends on your particular community what those might be. But that's that idea of identifying that root cause of the problem. So we can't just say, oh, the problem is homelessness. Is it? Not necessarily. There's other pieces that we actually need to be working on. And we may not be able to solve homelessness with our policy, but we could actually then go to tackle one of those pieces, or maybe several of those pieces, with our policy and our intervention. Okay, so part of it is identifying that root cause, and then the next step is to decide where we're actually going to try to intervene and what kind of policies that we're going to need to do that. So who are we going to involve in this stage? Well, stakeholders for sure, right? If you can talk to the stakeholders, they're going to help you with identifying that true underlying problem. If you're not talking to the people who actually work in this community, in this part of whatever it is that you are caring about, then we're not going to be able to actually understand that underlying problem, right? Most of us are not experts in everything, so even if we notice that something is a problem in our community, if we're not involving people and asking questions, it's going to make us miss something, right? And also, we want to frame the problem accurately. Problems are unique to their context, so you're probably going to have to talk to several different stakeholders to get the full picture. Okay, so once we've identified the problem, then we need to go to policy analysis. Okay, we're going to look at policy analysis. And in this section, we're actually going to be identifying potential policy options that could address that problem, right? There's not just one way to go about this, right? And so we need to think about, okay, what are the options for this, right? So we need to identify those different things that could address our problem. And then we want to compare those, because here's what we're shooting for. We want that policy to be efficient, effective, and equitable, right? That's what we're aiming for here. Efficient, effective, and equitable. But we also have to check to see if it's feasible, right? We may have a really great idea, but we just can't do it. So that policy option would have to be off the table because that's not going to help us with that. And of course, efficient, effective, and equitable. How many of us know a policy that perfectly does all three of these? Right, it doesn't. But we're shooting for the most efficient, most effective, and the most equitable. So we need to keep all of those things into consideration when we're looking at these policy options and make sure that we're not so heavy on one of them that we're leaving out the other two completely, okay? So conducting a policy analysis ensures that you have gone through a systematic process to choose the policy option that may be best for the situation. And who can we get involved here, right? It might be people who can provide or interpret the information about the policy. And this could be subject matter experts, economists, community partners, and they can contribute by providing and interpreting information that you need. Because again, you may not be an expert in this policy analysis section, but that doesn't mean you can't be involved in this and start helping by asking people in your communities, by asking people whose jobs or lives might be affected by this policy. And they can give you that contextual knowledge to say, okay, wait, we've seen people do this before and it didn't do that, right? We've tried this before and the city council said no, right? So involving those public officials, involving that community of people who this relates to, can always help us to understand. And the CDC actually, the website has excellent information on conducting a policy analysis and the steps that you need to take to do it properly. And so on that website, they actually include several tools. Two of them I included in your handouts for today. One is called the Policy Analysis Key Questions, and the other one is called the Policy Analysis Table. Both of those, like I said, come straight from CDC, and if you go to their website looking for policy analysis, you'll see that there's even more information. But that's really a good way for you to get a start on how do we start to weigh out those different policy options. You also should be concerned at this stage of what we call agenda setting. So one of the differences between what we look at in political science and what is here on our steps for today is that you have to get this problem on the agenda. And that doesn't just mean on the agenda for a meeting somewhere. What it means is you have to get it in policymakers' mind, right? You have to get it on their table. You have to get those people who are actually going to be in charge, and that depends on what you're going for, whether that be federal, state, local, or county, right? Or even tribal. So who are those people that you need to get this on the agenda for? And you need to get it to where it's something that they actually care about, that they're going to help you get this through, because you can't get it through without the people who are in the position to make the policy. So it's really important here at this stage that you're making sure, because all of your hard work will be for nothing if you can't get people to care about the thing that you want to get passed if it's not on their agenda. So a huge part of this policy analysis is also setting the agenda. All right, so the next piece is what they call strategy and policy development. And so, of course, that's really what we're talking about today is developing policy, but we have to cover all of the bases of the policy process to be able to do that. So again, if you look in political science, they actually call this policy formulation, where you create a policy. This stage involves planning how to develop and draft and prepare for enactment of your policy. And it's important because creating a strategy and drafting policy can help you make that policy option you select actionable. Okay, so you've looked at the different policy options, you've decided this is the route you want to take. Okay, and this process can look really different depending on the policy you selected, right? Who's going to be involved here? To understand the strategy and policy development process, you will probably need help of stakeholders in this case too. The process here is not really always straightforward. You want to consider which stakeholders can help you to develop the strategy and the policy. People who can help you with this clearly are those who are affected by it, community members and leaders, policymakers, subject matter experts, right? People who understand the legislative process. Now, this is a really important step. So not even a policymaker itself, but what you really want to do is find somebody who's already working in this area, who's maybe helped get other policies passed, who would be willing to sit down with you and ask how to get this through the legislative process. I have a student currently who is actually working to try to get some legislation passed, and he has zero clue of how to walk through that, okay? He admits that. But what he was able to do was find somebody who's been doing work in this area for a very long time. And they actually he was able to get with this person, okay? And while he was able to do that, then this person helped him to walk through the process of how is it going to be, who are we going to need to work with as far as these policymakers are concerned. So a lot of what we're talking about here today involves you searching for those people who can help you get through that legislative process, because clearly that's not on most of your purview, right? Most of you have your hands full enough with a job that you're already doing that getting through, okay, I might be able to come up with an idea or a policy option, but how do I actually get this through? Who am I going to get to do that? So that person can help you to develop communication strategy and materials, and they can connect you with key contacts and partners and figure out clearly what the next steps should be. So people who can help this are subject matter experts, and again, people who understand the legislative process. So what you really want to do here is to develop your enactment strategy. You're going to want to identify the steps that you and your partners are going to take to enact policy, and this is where the stakeholders come into play. If your policy involves writing a new policy, your stakeholders will know, usually from past experience, the best contacts and partners who can help guide you through this, because they probably have traveled this destination before and hopefully successfully navigated the route, and you might learn a lot from them. Stakeholders might also be able to help with the timing of the policy, okay? When we develop and draft policy, we need to start to think about what is going on in the world. Is this the right time? We're going to look at actually John Kingdon's model here in a minute to help us sort of understand about timing and how policies get passed and why they don't get passed and how they can get lost in the shuffle. And of course, like I said, who can help subject matter experts, right? So we want to start first by finding pre-existing language for the policy, and this might come from a model policy or policies that others have drafted. So in other words, you might not have to start by reinventing the wheel, right? Part of that policy analysis section may be to consider what's been working for someplace else. So here's that three streams model that I mentioned. So this is actually done by John Kingdon's, it's a book called Agendas, Alternatives, and Public Policy. On the references page, you actually have a short summary of this. So if you're interested at all and maybe learn a little bit more, you might read through that summary that is by Suzuki. It's again, on your reference page. And then of course, if you're even more interested then Kingdon's actual book is a really good read for this. So this stage in policy enactment can be the most difficult. You've put all the work in the first few stages of the process, right? And now everything has to fall in place for the policy to actually be voted on or enacted to be implemented. And this is a really good way for us to think about this. And this is what Kingdon talks about, these three streams, okay? It can really help us understand the process. And I like this graphic. So when I first started grad school, we had to create this ourselves, and we didn't have any of these nice little graphics. And so a really good way to think about this, I always say, is Ghostbusters, right? I'm going to date myself here just a little bit. Hopefully most of you have seen that movie at some point in time. But remember how during most of the movie, each of the streams had to stay separate, right? The entire movie you kept hearing, don't cross the streams, don't cross the streams, right? Well, that's exactly how this is in the policy world. These three streams, the problem stream, the policy stream, and the politics stream, stay separate, right? But once they got to the end of the movie and they were combating the Stay Puft Marshmallow Man, right? What had to happen? They said, we have to put the streams together. Of course, there was a big backlash. No, you can't. But Kingdon would argue that by you have to pull those three streams together. And what happens then is what they call the policy window. This is your chance. Your window of opportunity opens when all of the streams can come together and you're able to get that policy passed through here. Now, if any one of these streams is not where they should be, you're going to have a much more difficult time getting that policy through. So if that window opens, it may shut again, right? You only have time. It's like a little portal to get all three of these streams together. And if you can, you have a really good potential of getting that through. But like I said, if any of these pieces are falling behind, when you push through, it's not going to get to that window, and that window may close, and you have to go back to the other parts of the policy process. Because what you'll have to identify is which one of these streams is actually your hang-up, right? And that's when we'll have to go back and talk to those stakeholders and the people in that part of the stream to sort of figure out what it is that we need to change or do or revamp, or maybe even have to start over before we can get everybody that are in these streams to go. So just a quick note on the three streams, this problem, policy, and political. The problem stream is the condition that's the problem. So it's just identifying, is it really a problem? Do enough people pay attention to it? The policy stream is, have we looked at the alternatives and are enough people on board with that alternative, that policy option that you've chosen? And of course, the political stream is the willingness and the ability of politicians to actually make a policy change. So of course, that's really a tough one, right? Our tough one is that political stream, that politics stream, of making sure that we have the politicians on board for what it is that we're trying to do. Otherwise, our other two streams are just flailing there without that third stream, okay? The next stage then is what we call policy and enactment. Now, you're gonna see this sometimes in other policy models called legitimation or adoption. Basically, what happens is, this is when we're getting that official permission. So maybe it's passing legislation, maybe somebody on your city council said, yes, go ahead and do this, yes, it's okay to do that. So we're enacting the policy. We get that green light officially to go ahead and implement our policy. And of course, policies can be enacted at multiple organizational levels, from school districts to federal agencies. And this enactment is important because we can't implement a policy unless it's been officially authorized, right? So if you want to implement a new physical activity guidelines for schools, you would need an official go-ahead. And maybe that would require a vote by the local school board, or it might require passing a bill in the state legislature to get it done. Okay, so we really are thinking about who's going to get this policy through for us. And of course, we want to involve our stakeholders in this, and this depends upon where we're at. Are we at the federal, the state, or the local level? These are typically the people or organizations that can create, pass, and enforce the policy. So we for sure want to consider involving stakeholders who are supportive of the policy, as well as those who may have concerns. And so this is a good time for us to sort of talk about what I call negative stakeholders, right? People, may say, oh, some people have concerns. What those really are negative stakeholders, right? We can't just include the people who are on board with what we're doing, because if we don't include the stakeholders, those negative stakeholders at the same time, they're going to trip us up every chance they get, okay? It's best for us to understand who they are and what their concerns are, so that we can probably, hopefully, address them along the way, and that we can make tweaks and changes to our policy options, so that when we get to that point, that all of that negativity doesn't come right before we get to that policy window and shut us down, okay? So a really good example of this is, the movie It's a Wonderful Life, right? Old Man Potter is a negative stakeholder, right? He's on the board, and he's piece of that. He's always arguing against everything that they're trying to do there, right? In the building and loan. But they included him, right? George's father actually says, I included him because I thought maybe he'd go easier on us if we put him on the board, right? Now, of course, that didn't work out necessarily the way it is, but we're thinking about it in that context. Who are those people who I would call negative stakeholders, that are those Mr. Potters that we really need to make sure are at the table, even if it's harder for us, right? Nobody wants to sit around with a negative Nancy talking about how they don't like our policy option or that it won't work and those kind of things. But again, those people are the ones that are going to give you the most trouble as you're trying to walk through the policy process if you're not careful to include them at the time, okay? So again, this stage is not easy, all right? getting to this, you put in all this work, you've gone through all the things, you need to get this policy on the books, right? And you may find yourself going back to other parts of the policy process cycle once you reach this stage, because you may not get enough support for your policy options, okay? So it can be a long and tedious process. And so you can't get frustrated if that's the case. Policy, we always say in the policy world, policy changes typically incrementally at the margins, okay? Which means we make small tweaks to things that already exist. Huge overhauls are much more difficult to get past. I mean, if we just think about healthcare reform, you know, that's been on every president's radar since FDR, and look how long it took before we were talking about getting the Affordable Care Act passed, right? And even then, what a nightmare, and how much cajoling was going on, and how many things were thrown in there, right? I remember cringing when I heard Nancy Pelosi first say, let's pass this so I can see what's in it, right? I mean, what? But again, it's because that enactment stage is so difficult to do, because you have to get enough people on board with you that they actually will go ahead and pass through that. Okay. Now, so these are all the pieces, right, that come before. This is all the stuff that I think typically you guys aren't involved in. Notice how many places here that you would have to jump in, right, and help to create good policy, help to go through those policy options, work with those people in the legislative process to get this passed, right? You have this great opportunity as public health professionals to jump in there and help us to make much better policy, right? Because typically what we see is that you are here in the implementation stage, right? So once you enact a policy, that doesn't ensure a policy is going to be successful. Somebody actually has to carry this out, right? And so we're going to need to take additional steps to implement the policy in a way that can increase the likelihood that it's going to achieve the intended outcomes. So the implementing organization and the stakeholders may educate the people or organizations affected by the new policy, change pre-existing operations, or maybe create new ones. And they're probably going to have to monitor and enforce the policy as needed, right? Why is this important? Because policies don't work if the process stops at enactment. There's a wide range of people who have to be involved in helping to actually make this come to fruition. And as you implement the policy, stakeholders can help you, right? They can identify and coordinate resources and support. They can provide support for large-scale changes to existing processes, and they can plan for policy, programmatic, and fiscal sustainability, right? So here are the things that we need to keep in mind. Keep the desired outcomes in mind when we're implementing. Before this starts, everybody needs to be clear about the goal. And sometimes this is actually difficult, right? We see a lot of legislation, particularly in public health, that legislators pass what looks like doesn't have enough information. We're not sure how we're supposed to carry this out. A really good example of this is like the Clean Water Act, right? Clean water, basically Congress said, we need clean water. Okay, how do you implement that, right? So the pieces of that, all the different pieces of what we're going to now consider clean water actually came in the implementation stage, right? Partly because Congress was smart enough to understand they didn't know enough about clean water to put the specifics in, right? But that means that somebody on the implementation side has to decide what's going to go in here to actually get this the way it's supposed to go to reach these desired outcomes, right? And this is where you're typically sitting, right? You're typically sitting and implementing this policy that somebody has given you. So what do we do then? What else can we do here? We want to identify the resources that can help us implement the policy. And this can include funding, staffing, and infrastructure. And we want to define who is involved and who does what during the implementation. It's very important to identify who's actually going to be doing the things to carry this out, right? We can't just say, okay, here's our policy, we're done, we're ready to go, right? Specifically, we want to identify the individual or the organization that's going to lead. We want to know the roles and responsibilities of partners and stakeholders. And we want to talk about what the opportunities and processes might be for collaboration. So current policies, we need to double check this. So this is a really interesting current example. We have to actually look at what the current policy is to see if what we're implementing has any backup towards that, right? Because here's the thing, it might conflict. So again, a good example, New York City wanted to require people to wear masks, right, during our COVID-19 pandemic. But in order for them to pass the policy that everybody had to wear a mask, they actually had to repeal a law they had banning face coverings before they can implement the face mask rule. So one of the things is that you have to see is what you're trying to implement, does it already conflict with something that exists? So quickly they realized that they couldn't say you have to wear a mask if there's a law that says you can't wear a mask. So they took the law off, right, banning the face coverings, and then they were able to implement their face mask policy. All right, and then that last stage, evaluation. I'm sure most of you are at least familiar with the idea of an evaluation, right? We all get evaluated one way or another. But the CDC has an entire section on evaluation. They actually have a very nice booklet on how to walk through the evaluation process. And some of them, formative or summative. Basically, summative means you do it at the end of a program or policy, and formative means you're sort of doing it in the middle. We can call these process or outcome evaluations. Basically, the process one is more formative, and the outcome is what we call summative evaluation. But I won't spend a whole lot of time on this again, because most of you are in that implementation and evaluation type stages. You're actually looking to see if we need to make changes. Are we actually getting the outcomes that we want? And what do we need to do? And part of the job then is when you recognize, you know, it's difficult sometimes for us to have an evaluation because we feel like it's telling us that we're not doing the job. But really, an evaluation you should look at as a useful tool to make those incremental changes, right? It may not be that the policy or program you're working on is bad. It just may mean you need to tweak it a little bit. So having that evaluation actually gives you the opportunity to do that because you can see that, okay? So that is the stages of the policy process. Again, there are 6, right? Call them 6. CDC has 5 because they have evaluation all the way through here. And of course, we don't want to forget those stakeholders. Now, we're thinking about these 6 stages, right? Let's just do a quick poll here. Which of those 2 stages did I say are the public health professionals usually involved in? Where do we usually find public health officials? So here's the 6 stages. Which of the 2 did I say public health professionals typically involved in? You guys can go ahead and click those 2.
We've got 1 vote so far out of 15 of us, so put your option in there. It's anonymous. So don't be nervous if you think you might get it wrong.
Because I can't see who missed it, right?
Exactly. It's a pop quiz, but not nerve-wracking.
Right. No grades given today.
All right, we got 8 of 15. Where's our other folks? You sipping coffee, paying attention to something else. You need to know policy.
Well, we do have to remember, Emily, a couple of those are us.
That's fair. And I'm drinking coffee and paying attention to something else now.
Well, I switched to water because I don't need to talk any faster than what I do normally. So, okay, so let's look. So look, we have some confusion here, so that's good. So this gives me a chance to talk about this again, right? So typically what we see public health professionals are in, they're in the process at the end, right? You're implementing an evaluation, right? Policy implementation and evaluation, that's really where we see most public health professionals. Again, I'm arguing that you need to get involved in the rest of it, right? And maybe if you see a problem, maybe if you can problem identify, right? Typically, you're being stuck with those policies that somebody else passed that you didn't necessarily have a hand in writing, right? And so we want you to be in there on that problem identification. We want you to get involved in that policy analysis, looking at those best options, helping to develop a new policy, and helping to get it pushed through, right? So these things don't just push themselves through, right? They have to have somebody, they have to have a champion. Sometimes we call those people policy entrepreneurs. So I would encourage all of you to become policy entrepreneurs so that you can actually help to get these good public health policies together. And so then that will help us through that. So this is the end of our first part. As I mentioned, the part 1 was going to be relatively short comparatively to some of the rest of it. What we're going to do though is go ahead into the second part, and then we'll take a short break so everybody can have a chance to stretch their legs a minute and get some coffee. So let's look at the next stage. One other thing I do want to mention, yes, this policy process, as great as this looks on paper, doesn't necessarily go in a straight line. Remember when I talked about Kingdom's models, those 3 streams, and I said, you know, if one of these streams is off, what's going to happen, right, is that you're going to get thrown back into this policy process. And you may get thrown back into any one of these stages. You may have to go all the way back to the beginning. Remember when I talked about problem identification and getting the root cause, that may be an issue. You may get all the way down here to enactment and somebody says, hey, you missed this part. And this part is really important to what you're trying to do. So you have to go all the way back and start redoing and renewing and looking at different options for that and developing these policies as you go. So it doesn't go in a straight line. It can go all the way back. It can go one back or two back. So it gets very frustrating for people who are trying to get policy through, right? Any of you who've worked on anything, trying to get it through, you know that there's always a clash with somebody somewhere. So this can be really frustrating, but you just have to understand that it's always like that. The policy process is just messy. And part of it was created that way. You know, our system of government, which we're going to talk about in the next section, of federalism, sort of sets us up to have to struggle, right? It doesn't want us to be like super, oh, we had an idea today and then we change everything tomorrow, right? We got to have some sort of stability. And so when you do that, it makes passing policy a lot more difficult. So let's go ahead and look at this next piece of it. Part two, we're actually going to talk about government intervention versus individual liberties. We're going to look at some ethical considerations. We're going to talk about Schneider and Ingram's social constructions and who gets the benefits and who gets the burdens. And then we get to do a really fun little case study, so you'll have something more fun to do. All right, so let's go ahead and get into this first section. And like I said, once we get through this first part, then we'll go ahead and take a short break. All right, so at the heart of public health law is really the need to balance government intervention and individual liberty, okay? Because governments have the power to protect public health, but the US Constitution has actually not been interpreted to require federal, state, or local governments to actually assure communal health, okay? And that's always a big kicker to, you know, my public health students always say, what do you mean? What do you mean? It's not in the Constitution, but if you think about it, it's not, right? We don't have any constitutional something that says that government is required to provide public health, right? If you look in the preamble of the Constitution, that notion of general welfare, that could be public health. So basically, when federal government or even state and local governments wish to intervene in public health, they're using that kind of idea that that's part of the general welfare of the population. But there's nothing in our actual Constitution that says we're required to provide public health. And that's why it's so much more difficult for us to get those policies through, because we have to convince people that it's in the best interest of the population to do so, because constitutionally it's actually not mandated, okay? And so here's where we're gonna see a lot of disconnect. And this section, like I said, gets a little bit dry because it's government and politics, and you know, you guys are like, oh, but it's very important. And I think this is a perfect opportunity for us to sort of look. As we're going through this pandemic, I've had several of my students, and I assume, and I know some of my family members, and I'm assuming some of you have said, why all the disconnect between the federal government and the state governments? Why are localities doing things different? It's because of the way our government is actually set up, okay? As much as it seems completely chaotic, and it is partly because of the pandemic and we don't necessarily know what we're doing, right? But really, at the heart of it is the structure of our government and how that works and who has what power to do what. And so I think as we go through this, if you think about what you've seen during the pandemic and the different levels of government and what they've done, you're going to see that it sort of aligns with what they're supposed to be doing. And maybe that's good and maybe that's not, but I think it'll be a really good way for you to sort of see it. So this part won't be as boring if you start to think about what I'm talking about in the context of what you've seen the responses are for the pandemic. Okay, so of course we have 3 levels of government, and then the tribal, of course, is its own thing, right? All of you who live in Montana are very familiar with the idea of tribal and the fact that they have their own thing. So we're going to focus more today on federal, state, and local. And I know a lot of you do actually work with tribes, right? And you know that's a whole other monster. We could spend an entire class just to talk about tribal policy and how we interact with that group. But what we really want to look at today, like I said, is who's doing those things at those 3 levels, and why is it that we're getting policies sometimes from federal or from the state? When do we have the option to be able to do our own thing at a local level? And so again, we're back to thinking about the difference between government intervention and individual liberties. And our Constitution, if you know your Bill of Rights, which of course I won't pull you on that this morning, the Bill of Rights really basically is going to let us have all these individual liberties, right? We have free speech and freedom of press and freedom of assembly and freedom of religion. We have all these freedom, which is great. But then when the government's going to come into this, right? When the government's going to interact with this, you're going to get pushback anytime that we're going to step on individual liberties. And of course, with public health, that's all we're doing, right? If we're trying to make a population healthier with our policies and programs, literally we're telling people they need to change their behavior, right? Isn't that what we're doing? So clearly there's going to be a pushback for this, right? All of us can think of a great policy to fix something, but it would require absolute restriction in that process, right? And that's just not part of what the American ideal is. So it makes it a whole lot more difficult for us to get policy through. Okay, so let's just start to look at the national government, all right? So federal government has very specific powers. For the most part, they're powers that are given by the Constitution. Okay? There is a little bit of leeway here in what's called implied powers. Sometimes Congress is given that, oh, this is what this means, but mostly the federal level is limited by what the Constitution says. In other words, they have things to do like tax and spend, and they can regulate interstate commerce. So here's one of the ways that we see. For example, marijuana is illegal, right? Because the federal government labeled it a Schedule I drug. Well, the question is, do they have the ability to do that? And they do, because the Supreme Court ruled that marijuana is interstate commerce, and Congress has the ability to regulate interstate commerce. So when states are trying to pass to make marijuana legal, they actually can't do that. They don't have the power to actually do it, right? So again, I teach here in California where, you know, marijuana is now legal supposedly at the state level. And of course I teach a lot of undergrads here in the state of California. So I'm always really careful to make sure they understand that even if a state says it's okay, if they don't have the authority to say that, if let's say there's a federal officer standing there, right, that they can still arrest you because marijuana is illegal, because at the federal level, Congress actually has the right to regulate that and not the states. Now you might ask, why would the states pass these laws when they know they can't? Well, sometimes it's because legislators don't even actually understand that they can't do that. But mostly it's because states are trying to get the federal government to act. So if enough states start passing this, legalizing marijuana, then the federal government will have to come back and reconsider. And so typically they're doing that as a, hey, we want you to make some sort of move here, federal government. And so the states are pushing to get that done, okay? The president also has powers, not just Congress. He has powers under his commander-in-chief hat, right? So commander-in-chief, we think of military, but anything that's protecting the population is considered under that commander-in-chief, right, to protect the public. So when President Trump issued that nationwide stay-at-home order or a travel ban, that would fall in that category. So if he said, okay, we can't have any travel outside of the United States to this country or this country because of the pandemic, he can do that with his commander-in-chief power. Now, again, when I said he could issue the nationwide stay-at-home order, some of you are thinking, but all states didn't do that. Exactly, right? And where does that pushback coming from? And so we'll see that as we move through the next levels of government. All right, so the next one is the states. Now here's really where the power is, okay? A lot of times locals will have some power and you're able to do so, and it depends on the state. But really, like I said, federal government is so limited by the Constitution, right? Whatever is not given to the federal government is reserved to the states via the 10th and the 14th Amendment, right? The 10th Amendment said if it's not in the Constitution, then the federal government doesn't have it. When we created this country, you know, we wanted that strong sense of states' rights, right? We had just come off a monarchy, and the last thing that we wanted in that kind of situation was to have another monarch. So they were really limiting the powers of the federal government. And so for this, if it's not in the Constitution or an implied power, right, the courts have ruled that that's not under the purview of the federal government. All of the rest of it is left to the state government, okay? And so state governments get that authority to actually create policy through two different things: police powers and parens patriae. Police powers and parens patriae. So let's talk about the police powers. Now, of course, unfortunately, in the state of our world in the last few weeks, police powers makes people a little bit nervous, but this is actually more than law enforcement, okay? When we talk about somebody's police powers, they're really broad in scope, and they really represent the state's primary source of power to promote the general welfare of society, okay? These police powers have been defined as the inherent authority of the state to enact laws and make regulations that protect, preserve, and promote health, safety, morals, and general welfare of the people. Okay. Even in 2006, the Supreme Court noted that principles of federalism allow states great latitude under this police power to legislate for lives, limbs, health, comfort of all people. Okay, so the Supreme Court has even ruled that yes, in fact, these police powers do give the states the power to create policies that will impact public health. Okay, so this is an original source of public health law designed to prevent morbidity and mortality across populations. So police powers support public health measures for testing and screening, for vaccination, to treat people, to quarantine, and to isolate. We're going to talk when we get later about actual social distancing policies and why that is allowable for us at a public health level. They authorize creation of state and local public health agencies and empower them to conduct educational campaigns, surveillance, investigation, right? Now, states can restrict private interests in liberty, autonomy, and privacy with these police powers. Okay, as long as it's justified. And we're going to talk about at what point any of the levels of government, whether it be state, federal, or local, when the court might say that you've gone too far. Okay, so we'll look at that in just a few minutes. But for now, we're going to go ahead and look at that parens patriae. Parens patriae, that's a Latin term that actually means parent of the country, but it's used here in this as the country being the state, right? The state of, so the parent of the country. So parens patriae allows states not only to act in the interest of the community, but also in relation to individuals' own best interests. So it's this combination of community and individual, which is really difficult, right? Because what you're going to do is, if you're trying to make the community healthier, you're going to have to step on that individual liberty a little bit, right? So there's two major ways that we can use parens patriae powers. In the first one, the state might seek legal standing in cases that support the community's health and welfare, right? So let's say, for instance, the state sues the federal government on behalf of its citizens, compelling something specific like EPA protection to regulate greenhouse gases. So if states have said, hey, federal government, you're not doing enough, our people are suffering because of greenhouse gas, we need you to do so. So that's one of the things that they can do under their parens patriae, because they're the parent of the state and they're saying, hey, federal government, do something. The second one is that the state may serve as guardian of or provide protections for people who might otherwise lack capacity to look after their own interests, right? Or their own welfare. So they're allowed under these parens patriae to protect a child from mental or physical abuse or neglect. They're allowed under parens patriae to institutionalize a person with mental instability who poses a risk to him or herself. And they're also allowed to prevent harms to incapacitated older persons from their caretakers. Those are just three of the things, the ways that states actually use parens patriae. So this gives states a lot of power, right? Because here's the cool part. Again, national government is limited by the Constitution. Everything else goes to the state. Now, the state can keep all of that power to themselves if they so choose. The state could make every health decision, every legislative decision that they wanted to if they so chose to do so, okay? But a lot of states actually give some of that power to local levels, right? Local governments, local areas, local boards of health are actually the ones that are able to implement these policies and sometimes make their own policies, right? Again, they do have power. Now, of course, local are limited, that they cannot supersede state or federal guidelines, right? So here's just a quick look at local health departments, right? This is a really cool little map taken from the CDC. And of course, we know that our county and city and local public health officials, they're on the front lines of public health practice, right? You're directly responsible for conducting public health surveillance, for implementing public health programs that are funded by federal and local governments. You operate health clinics, you set public health policies. Performance of local public health agencies is also evaluated with national standards. Right? So local government's authority to act extends largely from a broad or narrow delegation of power. So this map actually shows us, if we look closely here, what we're seeing in this particular map is if there's a mix here. Notice all the states are not the same. So we started to see, this is when local departments do something different, right? So for instance, in Montana, right, this is very decentralized. What that means is that each of the local areas has been given power from the state, so they sort of have their own purview, right? An interesting thing, at the end of my spring semester, one of my classes, they were supposed to go and listen to a local health department to actually see what policies they were talking about. Well, of course, with COVID, everybody was doing that, and also their meetings were not in person, they were via Zoom. One of my students actually was able to attend 2 different meetings for 2 different county health departments, okay? And her response was, oh my goodness, they're going about this so differently, whether they're going to close down or whether they thought they had authority to do so. This one said, let's hurry up and close down. This one said, we're going to wait and see if we need to. And she asked, how is it that they can be so different? The counties were side by side. Well, they can do that because Montana is decentralized, right? So the state says, okay, you guys have this different powers, and then the localities are able to make their own judgments to an extent, right? Again, once you get to the part where you have governor's orders and how do you follow that, again, deals with how much local power everybody has. So local government's authority to act in the interest of the public's health extends largely from those powers, right? And what we call that is home rule over public health matters within your jurisdiction. Home rule is premised on the idea that the local government actually understands better than the state or the federal government what their people need, okay? So state legislatures, though, can take this away from you, all right? It's called preemption. They can remove home rule at will unless it's protected by provisions embedded in the state constitution. So just because the state is decentralized doesn't mean the power for local authority is the same for every area. So here's a good example. So look at Illinois. If you look at the map, Illinois is the same color as Montana, decentralized, right? And most of you have probably heard about Governor Pritzker because he's been in a nice little tweet war with the president over the past few weeks. The president telling him to go ahead and open back up. Of course, Pritzker's got the city of Chicago in the state of Illinois, and so his cases were going up, going up, going up. So he issued a stay-at-home order. And of course, the people in Illinois, like a lot of people in a lot of states, challenged this idea immediately. And then 1 of 2, 5, 6 of the different legislators in the state started looking at the Constitution for the state. And when they did so, they came upon a nice little clause that showed that the governor could invoke a stay-at-home order, but only for 30 days. Okay? When the 30 days was up, they expected Pritzker to lift the stay-at-home order. Well, he didn't. Okay? And at that time, a lot of local communities said he no longer has authority to tell us to stay home, and they began to lift orders within their communities. But in my hometown, which is in the middle of central Illinois, okay, a town of roughly 12,000 people, there were calls to the mayor to open the city, right? They were like, what, open up, his 30 days are over. Well, the mayor actually had to come and explain then through the newspaper the idea of home rule. And he said that that city does not have home rule. And so they can't go against the governor's stay-at-home order. Now, again, you're saying, well, if he only has the power for 30 days, but a court hadn't ruled that he had to stop at that point. So the mayor of my hometown said, we don't have home rule, we're not allowed. But some of the smaller little cities around my city were able to do so because they have home rule. And so people were very confused because they didn't understand why our mayor was following this governor's orders when they thought the governor no longer had the capacity to do so. But it's because the city did not have home rule. So here's how we sort of think about this. Local government's home rule may be limited even by the courts, right? The court started to rule with this way back in the 1800s, and it's known as Gillen's rule, the Supreme Court justice who actually wrote the opinion for that. And it says local governments are limited. Basically, he was arguing that the locals can only do what the state specifically tells them they can do, right? But what we've seen is that's not been the case. We've seen it go the other way around. And basically, as long as it's not restricted by the state, you're allowed to do it at the local level, okay? So in 2001, the Tennessee Supreme Court actually said we're going to look at the legislative intent instead of Dillon's rule, okay? Okay, so now we know that the national government, the state government, and the local governments now all have these different powers. So if we're thinking about it like in terms of pandemic, can we start to see what the president issues one thing, the states said yes or no, then the states actually either told their whole state, and even when they gave the states, sometimes they gave separate pieces of that, right? not everybody, even within the state, had to do the same things. And part of this is due to this idea of what we call preemption. Okay, preemption. So this is an embedded legal theory in the US constitutional system, and this refers to how a state or local law can be averted or displaced or negated by a higher level of government. Okay, so again, what it's showing you here is if you make a local policy and that goes against what a state or the federal would level, the federal government can preempt you. Okay. Well, what does that actually look like, right? So let's look at this nice little graphic here that shows us the preemption house, and this is taken from a public health law textbook by James Hodge Jr., right? And we're going to talk about three pieces here: the ceiling, the floor, and a field, okay? The field that goes around it. So with ceiling, you look at it this way: state or local laws that impose stricter standards than those at the federal level can be preempted if the federal standard is actually set to be the ceiling. Okay, so if a state makes something that is stronger than what the federal level set, now it can be done if the federal government doesn't set it as the ceiling. Okay, the ceiling, which lower level governments cannot exceed. So here's a really good example for us to understand the ceiling. The 26th Amendment to the Constitution sets the legal voting age at 18, right? States cannot go higher than that. In other words, a state can't raise the legal voting age to 21 because that rule that the Constitution set it at 18 is a ceiling. You can't go above that because the ceiling is set by the federal government, okay? But if we look to the opposite of that, sometimes federal law is set as a floor, okay? So if this is when the federal government gives a minimum that you have to get to, but you're allowed to go above and beyond that, right? So the government is setting the floor to this, but is not saying that you can't go above, right? So a good example of this would be Medicaid, right? States have Medicaid, but that's considered the floor because states are allowed to provide more benefits than what the federal level set, right? And several people have done this, right? If we look at this is 37 states that have actually expanded their Medicaid, including Montana now. Not that the voters got that through, right? But when that was actually signed by Governor Bullock May 9th of 2019. Again, there's a whole big debate on what's included in that and the 1115 waiver proposal. So we'll see, because of course that request is pending. But if we look at this map, we can see that certain states chose not to expand. They don't have to. They've met the floor by having Medicaid programs, period. That's the floor. But they're allowed to go above and beyond that if they wanted to expand Medicaid because the federal government only set this policy as the floor, okay? And the last piece we're going to talk about is the field, and that's what goes all the way around this. And so it might preempt similar state or local laws altogether, even if that federal law insufficiently addresses public health outcomes. So in this way, federal preemption can strip state and local governments of their ability to address public health issues. And we'll actually see a really good example of this when we finish our first case study today that looks at the SSB tax. Okay, so of course preemption can be a good thing. Preemption can help, it can hinder public health goals. Federal preemption has been used positively to create the national floor, like menu labeling provisions, but also it can be used to thwart state and local government's powers to be able to do that. So one of the issues is like through maybe gun control or food policies or employment protections. States may want to do more than that, and the federal government says that you can't. Okay? So the federal government says that you can't. All right, so now that we've covered all that constitutional stuff, and like I said, hopefully you're seeing now where that disconnect comes between the federal government, the states, and the local, especially as we apply it to the pandemic, and why it looks like it's such chaos. It's because it actually is such chaos. And it's not to say that they're not. Again, part of it is that we didn't necessarily understand what we're supposed to be doing in a pandemic, and we're not understanding that virus as well as we need to. But a lot of it actually really has to do with the structure of the way our government is set up and who has authority to do what. All right, so we finished this section. Let's take 5 minutes and get some coffee and a break, and we'll come back and talk some more about the Constitution. Okay, hopefully everybody had time to get some coffee. Like I said, I'll stick with water so I don't talk any faster than I already do. We had a good question here in the chat box that Emily pointed out to me. So she said, this question is, what about health department employees working on policy process, or what's restrictions, right? So here's the thing. if you're not involved, who's going to do it, right? I mean, that's really the piece of that. You have to be, I mean, if we're not, we're just going to get policy passed by people who don't know what they're doing, right? This is my argument for that. Now, the only hang up would be is the part where you're having to actually deal with policies, like policy makers, right? You don't want to look like you're being political, right? When you're working for the public's health as a whole, right? So, and this may be a point where you're actually working with somebody who knows and understands that legislative process, and it can be the one then talking to those policy makers to get it through, right? But if you're not the one who's identifying the problem and looking at the different options to deal with that policy, and then getting that onto the radar of those people who can pass it, right? Again, you're gonna just let them make policy that they don't necessarily know anything about. So I understand what you're saying. You're asking that part of it where it becomes political, like we're looking like, oh, this is a Democratic something, this is a Republican something. Yes, and again, you're gonna have those people on board. And ideally, if you can have both sides on board, then you don't have that problem. But if it's not, if it's going to have to be something that one side or the other is fighting for, yes. If that begins to be uncomfortable, or that it doesn't, you know, you're not thinking, oh, as a public health employee, I'm supposed to be protecting all of public health and this looks too political, right? So that is where you can stop, right? You can get those people involved. But again, I would argue if you're not the one looking at the problem, and you're not the one who's actually helping to go through those policy options and push for a good solution, how are we going to get any better at public health for that, right? And even if you're doing something that's maybe at your state level or local level, right? If you think that there needs to be, say, a sex education program in your schools, somebody's going to need to go talk to the schools and to the parents, right? Who else is going to do that? You're the one who has the data and the information and the policy options that you can explain to them to be able to push that policy through. And if you're not the one there to do that, all the pushback from parents and then schools just saying, oh, we just don't want to cover this, we don't want to make parents mad, how are you going to get that into there? So you can get involved in that process, again, as long as you're not hitting that political wall that maybe makes you feel uncomfortable. And hopefully that answered your question. And maybe some of the rest of you have that same question. So, okay, let's go ahead then and look at this next piece. We're still in that whole public health law purview, but we want to look a little bit at constitutional individual rights. Okay, so there's our little preemption house that we had from before. We've added the tree, which is our separation of powers that says each area of government has a different thing to do, and federalism that says we're layered, right? One of the old things you probably learned way back in American government class was the idea of federalism, right? That the national, the state, and the local each have their own level of government, and it looks so pretty, like a layer cake. And then as we started to really learn about it, we realized it looked more like what they call the marble cake, because it gets all messy, right? It gets all messy. So how come it gets like messy like that? Well, part of it is because of this little fence we have here. This little fence in front of us is those constitutional individual rights, okay? The individual rights. Notice here on this fence is things like due process and equal protection and freedom of speech and right to travel and right to privacy. All of those things. So now we've got this fence up here that goes on top of all that that says, hey, we as individuals in this particular country have all these individual rights, and those affect how government regulates the interests of public health, right? So the private sector doesn't owe individuals respect for constitutional rights whatsoever. The government actually can't infringe on fundamental individual rights unless they have sufficient reason, okay? So constitutional rights are not absolute. They are subject to constant balancing under various rules and tests, and the Supreme Court has done a pretty decent job of developing different levels of scrutiny or standards. Now, who they put in those categories is sort of a piece of contention, but they do have different levels of what they call scrutiny. And the Supreme Court and other courts actually apply in assessing potential infringements of individual rights, depending on a bunch of different factors, okay? So let's just look at the different levels of scrutiny that the Supreme Court has outlined for us. So this is the constitutional levels. There are three, what we call strict scrutiny, what we call intermediate or heightened scrutiny, and then the last one is rational basis. So if you hear somebody say, oh, it's the rational basis test, these are the kind of things that they're talking about. These are the levels of scrutiny. So what that really effectively means is that, and this is important to us, okay? You're thinking, why in the world are we talking about the court and all these different levels of scrutiny? Because when we go to create a policy and we want to get it passed, part of what we have to think about is, will it stand? Legally, have we done the right thing? Have we looked at how the court's going to look at this policy? And have we entered one of these spaces? Is our policy going to be able to stand up in court, or are they going to throw it out because we've moved up as far as scrutiny goes? Okay. So the top one there, that's the highest, right? That's the strict scrutiny. When fundamental rights like bodily privacy or suspect classes. Now, classes in this case, if you see on this, it's race, ethnicity, alienage, or national origin. If those are implicated, then the government action has to be narrowly tailored to serve a compelling government interest, and it has to represent the least restrictive means for accomplishing the objective. So if you're dealing with any of those things, okay, it's exceedingly difficult for government interests to prevail. They're typically struck down by the courts. Okay, so if a public health regulation or policy discriminates openly, or what the court calls on its face, if it discriminates openly against people on the basis of race by denying them access to public health services, that's going to fall in that level of strict scrutiny, right? So, and this is an old case, but in 1900, there was a devastating hurricane in Galveston, Texas, that killed thousands of people, and essential supplies were reportedly distributed first to the city's white citizens, and whatever was left every day was later given to their African American citizens. So a law or a policy like that is contrary to equal protection principles, and of course, absent a compelling government interest, which is highly unlikely because it was patent discrimination, would be considered unconstitutional, because that policy, that what they were doing, was based on race. Okay, and you're not allowed to do that. So anytime we're dealing with something when it goes specifically for a race or a suspect class, ethnicity, or putting them in a category of stuff themselves, it's probably going to have a problem in the court. Okay. The next level is what they call intermediate or heightened scrutiny, right? It's heightened scrutiny. In other instances, government actions or laws implicate individual on grounds of gender, legitimacy of birth, sexual orientation, or other bases. Courts will assess whether there is a substantial relationship with important government interests, okay? Now, meeting this standard is easier than the strict, okay? But we have to be really careful. Notice the difference here. Notice that race is covered under strict. But ladies, where's gender? Oh, gender is only heightened. And so is, by the way, sexual orientation. Those are not in that strict level. So that means that there are policies that can get passed, not at that strict level, but in this more intermediate. Okay? So in some cases like this, here's an example. Implementation of maternal health services. Public health agencies may have sufficient justification for discriminating on the basis of gender. So way back when, in 1974, California Disability Insurance because men and women are not the same. In other words, you don't have to provide for pregnancy because gender doesn't matter. It's fine. We can discriminate against the women because they're not the same. Well, of course, Congress later prohibited pregnancy discrimination in 1978. But initially, and it was because gender is not held to that strict standard, it's just the intermediate standard. Okay. And in 2015, when the Supreme Court looked at the gay marriage, the right to marry for same-sex couples, some scholars thought the court might reason sexual orientation as a suspect class and move that into strict. Now, the court actually did not move it, okay? It's still in that intermediate level, but they said that violations of due process and equal protection were enough to overturn that, to allow same-sex couples to marry. But they did not move that up to strict scrutiny. So in the actual court proceeding, they didn't. So they're still in that intermediate with gender. All right, so rational basis, this is basically like the floor, okay? In a lot of other instances in which government actions infringe on individual rights or interests, there's just a minimal level of scrutiny applied. Governments need only demonstrate that there is some sort of rational basis for what they're doing, right? A reasonable relationship to a legitimate government interest. When you contrast this with strict, whenever courts employ the rational basis test, usually the court will say, okay, this is not a gender issue, this is not a race issue, this is not a sexual orientation issue, so we're going to be able to use rational basis here. And then we're going to say, okay, let me look at the law, the legislative intent and purpose, right? And that's what they're going to look at, separation of powers. The court doesn't like to interfere with the legislative process unless they absolutely have to. Okay, so they're going to go with that under the separation of powers. So long as government can show a legitimate purpose, then the individual rights can be curtailed. So as a result, public health laws measured under this standard usually survive. So if you're creating a policy and you're not dealing with those top two, and you can show it's a legitimate interest to public health, your chances of it passing through a court system are going to be a lot easier because you're going to hit that rational basis test. Okay. Like for instance, the Supreme Court might even, sometimes they tweak it, like they get a little more strict, but it's still rational basis. The city of Cleburne tried to make a local zoning ordinance saying that you couldn't put a mental institution within the community. Well, the court said they couldn't do that because there was no legitimate government interest to do so. So it discriminated against those persons with mental disabilities. Excuse me. So those, again, that was rational basis, but even then the court said, okay, but you can't do this. You can't just, there's no legitimate government interest here for you saying you can't have a mental institution in that local community. Okay, so now we've talked about these three levels of scrutiny here, and what are we doing with those, and who lines up where, and how are we going to get our policies passed. So part of what you're doing then, as you're looking in that policy analysis section, right, you're looking at the different policy options, you have to think to yourself, okay, wait, first of all, who has the authority to do so, right? Is this a national government? Is this a state government? Can my local government do this, right? Then you have to ask yourself, okay, does it involve any of these suspect classes with race? Is it going to be under strict scrutiny in a court? Ooh, is it deal with gender, or does illegitimate children, or quasi-suspect classes, which is what we consider sexual orientation? Okay? Or is it just a policy we want to create for everyone in town, right? Is it doing that? And in that case, do we have a legitimate government interest here to do so? Then we're going to be at rational basis. So it's really important for us to understand this law part of the deal, right? Because if we don't understand how these are going to come out, we may easily create a policy that puts us in one of these categories, and then again, it's thrown out. We do not want to go through that entire policy process to get something implemented to have it thrown out by the court if we can help it, okay? So that's really the importance, and that's why we're covering it today, because when you're developing policy, right, you really need to look at those options and where are you at. And we're going to see sometimes in our case studies where sometimes people paid attention to that and sometimes they didn't. And what happens when you don't pay attention to that court piece of it, okay? So let's go ahead here and do a quick poll. I'm going to give you 1, 2, 3, 4 questions here. Pick which level of scrutiny those are. Well, we'll just go through them. How about that?
That works.
So number 1 is, which level of scrutiny is gender? Right? And let's just go back here for those of you who may have forgot, because I took that away from you, right? Gender is in that intermediate, right? That heightened. Remember, it's not at the top, it's not in that strict. If we look at number 2, though, the level of scrutiny for race is in fact strict, right? And sexual orientation falls in line with gender at intermediate, and stay-at-home orders actually is rational basis, right? It's a rational basis. And why is stay-at-home order a rational basis, right? Because it's for everybody, right? It's not based on race, it's not based on gender, it's not based on sexual orientation. So that means that when they say, okay, everybody in the whole county has to stay home, that would be a rational basis test. And a court would look to see if the government had a legitimate interest in doing that, right? And of course, if it's to protect population health and to lower the spread of COVID-19, that would be considered a legitimate government interest to do so, right? So there's that rational basis test for that. Okay, so, and of course I threw that one in there on purpose. That notice stay-at-home orders don't fall in line with that constitutional level of scrutiny. So we're going to see some of these things play out, right? We're going to see that, you know, we know that this COVID-19 is not over and done with, right? And what are the policies and procedures that we're going to have from moving forward? And which one of those are going to be challenged in the court? And where is the court going to put this kind of thing, right? How much is it coming at people, right? Or is it going to be moved? Are we going to say, well, even though it goes for the whole population, that's not okay? What if we actually were at the point where we could make just communities stay home, like individuals in neighborhoods, because they are the ones who had it? We would then be maybe moving up into these other classes, right? By saying the whole city or the whole town or the whole state has to stay home, we keep ourselves at that rational basis. But, and we have to be really careful, because if we start to say, and this is part of the idea. Think about the contact tracing, right? And, even the idea of using the app, that's an individual liberty issue, right? But let's say we were able to let's pretend the United States all of a sudden decided that that was a great thing to do and we were all going to participate and it was going to work perfectly. If that's the case, right, what if then it identified this little community of people that had COVID-19 and they were supposed to stay home? Now we're actually implying some sort of government intervention that is not applied to everybody. And then would the government be allowed to do so? Well, we don't have the answer to that just yet, right? But it would be something that we would have to think about if that was our policy, right? Policymakers would have to be very careful about putting classes of people, whether they're communities or particular, because think about communities, how they're broken down, especially in large areas. There are communities in race, right? This is the Chinatown part of town. So are you able to do that and allow it to be more constitutionally acceptable? Will the court, okay, but it's okay. It's still, because they can still say it passes the test. If the government didn't do it on purpose to narrow that group out for a reason, right? If they said, well, here's the reason we did it, because they have 300 cases of COVID and no one else in the state has any, that was our legitimate government interest, and that still could pass even though that's strict scrutiny. So we'll just really have to see how this stuff plays out. Again, it's important for us to be thinking about this because a lot of you are working at a local health department. How do you know what to do? You should be looking at this. What are the policies? What are the procedures that you're using? And do you have authority to do so? And then, which of these levels will that fall under if it's not just a blanket policy? Because, a lot of people I've heard, have been talking about the idea that maybe at some point we can just shut down pieces. But again, I'm not sure constitutionally that we can get away with doing that without shutting down whole areas at once, unless we can pass that strict scrutiny. And the Supreme Court's probably going to have to jump in and talk to us about that before we can go any further. So how do we do this? It's a balancing act, right? So at the heart of public health laws are these struggles to determine the point at which government authority to promote the population's health has to yield to individual constitutional rights, okay? It always comes back to that community or that government intervention versus the individual interests. So it's interesting because for much of our country's history, the balance was weighted in favor of public health because we had so much disease and pandemics, and we had this back in 1920. So countless court decisions through the early 1900s actually found in favor of the state or the local government if they were seeking to protect the public's health, sometimes to the detriment of individual rights, right? Courts justify these decisions in part by the strong need for public health measures to control infectious disease, right? And chronic conditions, things that there were no cures for that were affecting huge parts of the population. Public health actors were granted significant deference to stymie these threats to the health and the economy. But other legal factors were also at play. So remember when we first started talking about the Bill of Rights is what gives the states that power, right? But they hadn't really recognized necessarily that all of those applied to the states. It wasn't until we added that 14th Amendment that all of the Bill of Rights actually began to be applied to the states, okay? So the 10th Amendment says if it's not in the Constitution, the states have purview. But the Bill of Rights, that first 10, those were never applied to the states until we passed the 14th Amendment, right? So First Amendments didn't fully apply to the states until 1925. You didn't necessarily have a First Amendment right within your state because it didn't apply, okay? So we have to think about part of the reason that there was a deference to these things is because the states didn't have that kind of power, or the states had more power at the time because they weren't having to go by those Bill of Rights. So individual liberties were easier to walk on back then. Of course, one of the biggest cases, the most often cited cases in public health, is Jacobson versus Massachusetts, right? So the Commonwealth, just for a refresher, I'm sure that name sort of rings a bell. What is that court case and why would I remember it? The Commonwealth of Massachusetts legislature enacted a law that said local boards of health could require vaccination of residents if necessary for public health or safety. So they were facing a potential outbreak of smallpox. So the City of Cambridge Board of Health, the Board of Health, mind you, issued a vaccination requirement in 1902 that every person had to be inoculated or had a $5 fine. Now, of course, in our day and age, $5, but back then in 1902, $5 was quite a hefty fine, right? So Jacobson refused to get the inoculation and he sued. Well, the Supreme Court rejected him and said that they looked at it as more of a community-oriented approach in which citizens owe each other and society as a whole. So Justice Harlan actually wrote this, and this is a direct quote from Justice John Harlan in his writing of the court case, Jacobson versus Massachusetts. And he says, "The liberty secured by the Constitution does not give us an absolute right in each person to be at all time and in all circumstances wholly free from restraint. There are manifold restraints to which every person is necessarily subject for the common good. On any other basis, organized society could not exist with safety to its members." In other words, efforts to address communicable diseases, for example, might include an education campaign. So like a family planning center offering voluntary sex education classes. So you could come to them if you want to. You're not required to do so. If you have a vaccine drive, right? So I know some of you, we've been reading, we see that vaccination rates are dropping because people are afraid to go to the doctor's office to have their kids vaccinated, right? So a lot of communities are getting clever, right? They're taking those vaccines on the little bus, right? And they're doing vaccine drives, going to people's places, right? So that you can get that, but it's voluntary, right? You're not being required. It's not showing up and knocking on your house saying you must do this. It's giving you an opportunity to not come to the doctor's office to get it done, right? Also, testing or screening programs and treatment options could be that. And so in this case, individuals just seek out that information or their public health services on their own, right? So anytime we say voluntary, that's what it's meaning. We're giving you the option. Here's your choices. Here's the things that we can do. So that's one type of power, right? By just offering it, we're actually using a power there, right? Because we're giving them the option of doing so. The next step, and so these next two are fun because people sort of think of them as the same thing and they're not. So the next one is mandatory. This one sort of raises the stakes, right? When it's legally authorized, practitioners can implement public health interventions that no longer seek voluntary actions from individuals. Instead, they're going to set conditions on participation to encourage or require people or groups of people to protect the public's health to avoid penalties. Requiring citizens to be vaccinated or else to get a fine, like in Jacobson, is illustrative of mandatory, right? So anytime we have testing or screening or treatment programs that mandate individual compliance, subject to varying conditions, such as receipt of treatment or other services. Participation in a treatment program might condition on one's avoidance of a more intrusive public health measures, such as quarantine or isolation. In each of these things, mandatory public health powers are often challenged based on infringement of individual freedoms, even though individuals ultimately retain a choice. So here's the thing, it's mandatory. We still have a choice not to participate, right? Think about even the vaccinations that we have to have for our kids to go to school, right? Those are mandatory. Why are they considered mandatory? Because you just can't go to school, you don't have them, right? There is an opt-out still, even when we call something mandatory. My son's pediatrician, same way. You have to have your vaccinations up to date or he will not see you as a patient. It's mandatory. But your option is to not have him as a doctor anymore, right? So the last one then is what we call compulsory. Compulsory. So with the exercise of compulsory public health powers, choice is no longer an option, okay? The government doesn't offer a chance to participate to avoid a penalty or get a service or a benefit because you did. Your participation is by force, by any magnitude necessary, and these compulsory interventions require individuals to participate or change their behavior irrespective of consent. And you think, my goodness, when would that ever happen? Well, in the 1900s, it did, it happened. In New York City, public health officials went door to door and forcibly vaccinated adults against smallpox. So we have seen this happen. Would we see it happen today? I don't know, right? I think we get a lot of pushback if we pay any attention to the protesters in the last 2 weeks. We see that citizens aren't really necessarily under compulsory type powers, right? So this is compulsory public health powers are seldom used today, right? Because they really do run into what we call public health ethics, right? And again, we didn't necessarily have that ethics code. It's interesting for me to think about it now. You know, we look back at these kind of things when we talk about the Tuskegee Airmen experiment, when we're looking at, you know, giving groups of people, particularly African American males, you know, syphilis and just to watch to see what happens, right? And no one was saying, how can you do that, right? So we weren't at that place where we had this set of public health ethics. So things like showing up at someone's door and giving them a shot whether they wanted to or not, we're just seen as, hey, we're protecting public health. Again, today, we see that that's gone too far, right? We do, thank goodness, have that public health ethics to keep us, hopefully, from making those kind of mistakes. But exercise of compulsory power might fail to survive constitutional scrutiny, even if the government has a compelling interest, because you could do something less restrictive, right? You could do something that's mandatory. You could do something that's voluntary. So how do you get to that point that's compulsory? So even though there's these three types of power, really what we're looking at using are the voluntary or the mandatory, right? And how do we get people to do this and be part of it? And which one of these should we be considering when we're talking about creating a policy for our issue, right? But we do still see it, right? Think about this. If we have forcible testing of persons charged with criminal transmission of HIV, right? They have to have the test, right? Because they have to be able to determine which other individuals might be exposed. So if you're charged with criminal transmission of HIV, right, you are tested whether or not you so choose. Do so with your choice, okay? All right, so let's look at the next piece here. Social distancing, yay! Which is so funny, right, to a layperson, and some of you in public health may have already talked about this in this way, right, but social distancing has become the new term, right, that we've all gotten used to during a pandemic, but this is actually a long-standing public health power, right, social distancing. Social distancing, they have powers to test, to screen, to treat, and to vaccinate. Another slate of powers are available to control communicable conditions, which of course is nice and relevant to us today. Social distancing powers include the following, right? Quarantine, isolation, curfews, closure. Who knew we had these powers, right? Well, we do now, right? But these have been around. These are not new, right? We put it all together and talk about social distancing as in 6 feet away. But that term comes from this idea that to protect the public's health, we do have these tools in that toolkit: quarantine, isolation, curfew, and closure, right? Now, these aren't supposed to be punitive per se, right? We're not doing these things to hurt people. They're designed to limit the spread of airborne or other easily transmitted conditions, right? These powers are still we turn to these when other interventions are unavailable or ineffective, like for instance, what we're seeing now, right? So this is really interesting because typically when I cover this section prior to this year, everybody's like, wow, we don't use that unless, you know, somebody's super sick or we've got, you know, pertussis outbreak or something, we tell them to stay home and isolate, right? We don't think about curfews or closures. Literally, I've seen all four of these things happening, right? Think about it. And again, I live here in California in a nice little city called Claremont, but I'm about 35 miles east of Los Angeles, but I'm still in LA County. So not only were we under closures, right? Restaurants not open, whatever, we're at stay-at-home orders still. We're slowly moving in the other direction, but we've been under this since March 13th. But again, anybody who has any suspect of having COVID-19 goes either isolation or quarantine, depending on whether they've been tested for it or whether they just think they might have been exposed to somebody. We've had the closures, and due to the riots, we've actually had curfew. If we spent 5 days, 2 weeks ago under curfew, again, not for the public health per se, but to keep people safe, right? To keep people safe and off of the streets. So, like I said, a year ago when I talk about this, you know, students were saying to me, gosh, we don't use any of these things, and here we are right now. So it is important to think about all the different powers that we have and are able to do these kind of things. So sometimes federal health or state authorities might be authorized legally to apprehend or isolate somebody carrying any number of highly infectious conditions. However, in practice, typically we want to look at the ethical principles of doing so, and we want people to voluntarily comply, right? Think about this. If we say, hey, if you know you've been around someone who has COVID-19 or who might have COVID-19, can you just stay home for 14 days? We need you to do that, right? Or if they're not at the point where they need to be hospitalized, right? If they do have COVID-19, we ask them to go home and stay, quarantine themselves away from everybody else. So that's that voluntary power that we're using there, right? We're not putting a guard outside their door. We're hoping that they'll go with this voluntary power that we're using to do that, okay? Because partly because of the ethical principles, partly because the constitutional rights, right? So again, we also have the right to travel, but curfew orders could be necessary. We know the president has said you can't leave the country to go to certain places. Even though that right to travel is constitutionally protected, it can be curtailed when a community has been ravaged by anything from floods to fires to disease, or if safety and welfare are threatened. That's how they can use a curfew. That right to travel can be curtailed, whether it means travel outside the country, outside of the state, or whether it means curfew as in you can't be outside of your house. Intrusions on personal liberties, though, that come from these social distancing measures really vary, because of course they're restricting movement, right? We really don't want to do that unless we absolutely have to. And we've seen, right, in the last few weeks, how much people push back when we tell them that they have to stay at home, right? Notice everybody was pretty much okay with voluntary, and I say most people, you know, when states put the stay-at-home orders in place, lots of people were able to stay home, right, for 2 weeks. 2 weeks they were fine with it, right? And then we started to see protest after protest after protest about being able to go back to work, and the right to work, and the right to go provide for their families, right? We saw what were we hearing there? We were hearing that individual liberty coming out. And again, the justices would have argued back in the day that they're forgetting their social contract, right? That you staying at home actually then protects other people around you. It's sort of like wearing a mask, right? We know that you wear a mask, we wear a mask, and we're protecting each other in that same way. But if we can't get people to do that, and again, most of that's voluntary. I mean, now there was a couple cases in New York where people were getting fined for not having their mask on, but for most places, you know, you don't see officers running people down in the street because they're not wearing a mask. We're putting that policy in place, but it's still part of that voluntary power. Okay. So to support uses of coercive public health powers, public health authorities have to be prepared to demonstrate a lot of things. That the subject of social distancing is actually or reasonably suspected to have something, an infectious condition. The subject has to pose a specific threat to others' health. So of course you can temporarily quarantine a group of people after their exposure, such as smallpox, right? If we found out this group of people had smallpox, we put them there. We saw this in New York, actually, with the Hasidic Jews population when they had the measles outbreak, right? We quarantined that group of people. And again, that would fall under what? That would be strict scrutiny. But the ability to pass that to other people was too great, okay? So the government was actually able to do that, to isolate them. We see it when we isolate nursing home residents to prevent spread of infection, right? We're seeing it with the restrictions to not let people into nursing homes at this point in time, right? So also, if we're gonna isolate somebody or quarantine somebody, we have to make sure that the place we're putting them is safe and habitable, okay? Because that doesn't always happen. Literally in 1909, the South Carolina Supreme Court struck down a quarantine order because there was an older woman who had leprosy, and she was removed from her little cottage home and put in a place that had pests, and it was coarse and comfortless, she said. And so they said they couldn't do that. They could make her stay in her own little cottage, but they couldn't remove her and keep her away from other people by putting her in someplace worse than where she was. So, and of course, individual or group confinement, it can be warranted, right? Just like I mentioned with a measles outbreak or a smallpox outbreak, if we had something like that, we can do it. So again, would that be enough for us to quarantine just groups of people who had COVID-19? It sounds like that might be the case, right? But again, we would have to see, does that individual rights, is that going to supersede that when it comes to that disease? And who are we asking to put in quarantine, right? If we're hitting that race, that gender, that sexual orientation class, is that going to cause us some legal standing aspects for doing that, okay? So once we've passed that legal issue, right, we're still questioning how to choose an option, even if we know we can pass the legal test. So we've gone through the policy process, we've analyzed our policy options, we've got 3 or 4 on the table, and we say, okay, these 3 right here are going to pass, should pass legal muster, okay? But now, how much do we want to have as an intervention, right? How strict, how forceful, how much do we want to intrude on individual liberties? Well, we can actually use the intervention ladder to help us to do that, okay? So let's look at this. This is a great little useful tool for us. Here's the intervention ladder. And you can I just grabbed this from It says Biomed Central, but if you type in intervention ladder, it'll pop up in about 10 different places. I did include this in your handouts just so you have it as a reference guide to what we're doing here. So intervention ladder, right? Here are 1, 2, 3, 4, 5, 6, 7, 8. There's 8. There's 8 choices here, okay? But we're gonna look at them we're actually gonna start with this 2 and number them 1 through 7, okay? Because why? The first one is to do nothing, or just monitor the situation, okay? Which of course, monitoring is doing something, okay? But that's not necessarily intervening, right? So that's the base. So I'm calling that 0, okay? 0 is do nothing. So we're gonna number these then as we move up from 1, 2, 3, 4, 5, 6, and 7. And as we do this, think about this. So the second thing we can do is just give information. And then the third part, the third choice on the intervention ladder is to enable choice, or the second, I'm gonna say the second, enable choice, right? So you're allowed to change your behavior, Okay, so that's a policy option. We can give people a choice, right? And then we might move up one more and guide that choice by making the default a healthier choice, right? We make it a healthier choice. That maybe our policy is that we're going to provide a healthier option. And then maybe the next thing we need to think about is we could use financial incentives to get you to do something, right? Now this is like to give you something, right? Because the next one, if we go up, look, that's a disincentive, right? We use financial or other disincentives to influence people. So this would be like we taxed you, right? Taxed you. So, and then the next level is to restrict choice. We're going to regulate to restrict the options available to people. And finally, we eliminate your choice completely, okay? We eliminate our choice completely. Okay, let's go ahead and look at these individually and see where we came out. At eye level, if that's our policy to do that, and above other options, right? So the majority of you said that it was 1, 2, 3, making the healthier choices a default option. So yes, that's it. That's where we would fall right here. So we've actually jumped up a couple ways, and we're guiding their choice, right? Because we know if we put something at eye level, that's what they're going to seek, right? So they're able to do that. So that is, in fact, where it would be. So on the intervention ladder, where do vaccinations required to attend school? Where would this be, right? So we're not eliminating choice altogether, right? Because they do have a choice not to vaccinate because they could stay at home, right? You could stay at home and do homeschooling instead. We do actually see that. So we're restricting the choice, right? We're regulating to restrict their options. They must be vaccinated or they cannot attend school. Okay. The next one is the cigarette tax, right? Cigarette tax 1, 2, 3, 4, 5. Most of you got that one, right? So we're guiding choice through disincentive, right? We're using financial burden to get people to do so. And the next one is where on the intervention ladder does sex education programs fall? Of course, that one's down here, providing information to inform and educate people. Now, you could see it as enabling choice to change their behavior, but typically it's not necessarily a change of behavior if we're in education school, because hopefully we get to them before they've had any behavior. So really at this point, we're probably looking at hopefully providing this information to keep them from making some poor behavior choices, right? Where on the intervention ladder are the needle exchange programs? There's a little bit of disagreement on this. So options 2, 3, and 4. Where would we be, let's see, on needle exchange programs? So 1, 2, we are enabling choice for people to change their behavior, right? Guide through making the healthier choice, right? This is fall for the needle exchange programs. And then a couple of you actually put through incentives. Now, typically we're not seeing financial incentives, but again, you could make an argument for any of the things that you just said. How far are we actually going? We know for sure that we're giving them choice, right? We're giving them a choice to change the behavior. Healthier options, I don't know if a needle exchange program, I guess, I mean, you can see it as healthier because the needle is not dirty, right? But unless we're actually moving them out of the needle exchange and into some sort of treatment program, then that would actually be helping them for sure to make healthier choices. And we might be giving them incentives to do so. So notice how, depending on what we include in that needle exchange program, would be how far up this ladder it would go. Again, as always, anytime we use anything, models, policy, whatnot, any type of model is always subject to interpretation, right? But at least we can start to think about as what we really want to use this intervention ladder is not necessarily to be right or wrong, because again, part of us could argue along this ladder, but we want to think about that every time we take a step, we're actually restricting people a little bit more, okay? We're looking at that individual liberty, even if we're trying to do it through making a healthy option, aren't we still trying to restrict their choice at some point to take the water instead of the soda, right? So that's really what we have to stop and think about here is, so this is a useful tool to sort of think about, okay, wait, where am I at on this ladder? And have I gone too far? Because the court's gonna ask, right? Were there other alternatives? So of course, if we think about those sources of power, right? Eliminate choice, that would be our compulsory. If we start, we'll go to the top and come down. The mandatory would be to restrict the choice, right? And also mandatory probably even could be considered this disincentives, because if you're making people do something because you're financially squeezing them, right, to do so. But the rest of those are all fall into some sort of voluntary, right? So notice how when we talked about the powers that we said we typically try to do voluntary. So even when we're moving up the ladder, we're still trying to use that voluntary power, okay? All right, because we have to think about these ethical things to consider, right? So thank goodness I said earlier for ethics, right? Ethical things to consider. So there are 6 steps that we can sort of think about. And there's just 6 things. We're gonna look at them quickly because we're gonna move into the next piece of it, and we can actually see why this matters, okay? So the first one is that we wanna identify the goals that aid in decreasing morbidity or mortality. This goes under that rational basis scrutiny. Remember when we looked at it before, it said that the goal of public health is to decrease morbidity and mortality. So if we're identifying goals and policies that are doing that, we're already starting off on the right ethical foot, okay? The next thing is we have to determine whether their data exists that indicate that our tactics are gonna be effective. So does our policy have a leg to stand on? Have we seen this? Are we just pulling things out of the air that we might try? Or do we sort of have something ethically to stand on? Could we pull from other people, not reinventing the wheel? Do we have data? The next one is to consider potential burdens, particularly when we're talking about risks to privacy, liberty, and justice. Again, this is a good thing to think about both public health law, the levels of scrutiny, and also that intervention ladder. How far up that ladder are we trying to go here, right? We want to examine whether alternatives would mitigate these burdens while maintaining effectiveness. In other words, is there a policy that could be less restrictive to all these? Or are there burdens to a potential group that we need to mitigate, right? Did we distribute benefits and burdens fairly based on data rather than being arbitrary or stereotypical? And finally, do we analyze whether the benefits outweigh the burdens? Now notice when we look at these ethical steps, 3 through 6 mention benefits and burdens, right? Number 3, potential burdens. Number 4, mitigate burdens. Number 5, benefits and burdens distributed fairly. Number 6, benefits outweigh the burdens. So when we're thinking ethically about creating a policy, we're also thinking about who gets the benefit and who gets the burden. Now, very clearly, before I go any further, when you create a public health policy, someone will always get a burden, okay? We cannot create a policy in which somebody is not going to get a burden. When we're considering policy options, then we have to think we have to identify, we have to make very certain that what we have identified as who gets the burden is not so egregious, is not in such a lower socioeconomic status, is not so much so that they're already on the streets, that we have given them the burden on top of what they already have. And a good way for us to think about this is actually to use Snyder and Ingram. Okay, so Snyder and Ingram actually have a book. It's called Policy Design for Democracy. But a big part of their book here is actually using these social construction examples that show sort of how we think about people when it comes to making policy. Okay, now none of us like to put people in boxes, but this is actually a very useful tool. Okay, and we actually can look at this over time, and it's been used and applied to different policies and how people were able to get passed, right? You have to think about politicians, who has their ear, right? And in this social constructions, now, before I go too far, this is the original. It was actually in an article in 1993. Now the best part, any policy model that can be useful and used is good. But another piece of a good model is one that can be amended over time. So what actually you will see is that we see people moving within these 4 categorizations, and we see that some things are missing. We think, wait, like I don't even see homeless on here. Where's the homeless population? Where are those people on here, right? So in your handouts, you actually have what I call social construction examples, and it sort of shows the evolution of the social construction table. There's several other examples that have been used all the way up through 2016 to sort of show us how this has shifted over time. And again, that's not a bad thing. That's not showing that this doesn't work. That's showing us that we have the capability to mold it and keep using it as things change in our society, okay? So we're looking at this and we think, okay, a couple of things. One, if we look at the across ways, right, this is our power, our political power, okay? So the top row is strong. People who are considered advantaged or contenders have a lot of political power. So they have the ear of those politicians, okay? They have the ear of those who are sitting on the Board of Health. People at the bottom row, dependents and deviants, they have weak political power. Basically, nobody's listening to them, okay? And then we look at this, and the column actually shows us positive, right? That's people that are thought of positively in a community. And then the other column is negatively in a community, all right? So there's 4 different categories here. We have advantaged, contenders, dependents, and deviants. Those are the 4 categorizations. And notice in this example, again from 1993, so the elderly, business, veterans, scientists were advantaged. Contenders were the rich, big unions, minorities, people who were moving up. And we're going to talk about like how do they define those in just a second on the next slide. But again, we can move these, and they're not perfect, right? Because you could be in more than one classification, right? So what if you are a disabled elderly? Are you just in the disabled category, or are you advantaged because you're elderly, right? So again, not perfection, and of course seems very stereotypical, but the problem is policies typically follow stereotypical lines, okay? And we've seen it time and time again. So it's really important for us to sort of stop and think about who in society fits in these categories, okay? We have to think about that when we're developing policy. So if we look at the next slide, here's what their definitions are, okay? So if you're advantaged, you're treated positively in public and you get benefits publicly. Politicians have no problem giving you something, an advantage of something, because you fall in that line of people who are treated, you're advantaged, right? Now contenders still have some power, but they're the ones behind the scenes, negotiating privately to get some of those benefits, and the politician's not gonna run out and say, yes, let's do this for this group of people. And of course, dependents, they're treated positively in public, who doesn't wanna think about the poor kids, but they're not able to mobilize to get themselves more benefits. And then of course, deviants, well, the word itself tells us that they're treated negatively and they're punished by policy, right? And this figure 2 on the side here sort of shows you both the front, this is where the benefits lie, and there's where the burdens lie. And so basically what the argument is this, and again, you have this so you can look at it in more detail later. If you're advantaged, right, you're gonna get a lot more benefits and you're gonna get way less burden, okay? If you're a contender, you're gonna get benefits, but they're gonna be in secret, right? You're gonna get some burdens, and actually what we find happens is the contenders, they may be given a benefit, but we will be sure to tell people that they're gonna get the burden, okay? Because we wanna see that they're not advantaged. We want to make sure that people understand they're still in that contender category. When we get to dependents, same thing. They're given some benefits, but not to be what they should, right? We haven't covered every kid everywhere for everything. And of course, that means they also are given burdens more than they should be as well, based on our policies. And then if we look at the deviants, right, they have no control. Benefits are very under-described. Burdens are over-described. Right? Because once you get to that, ooh, you're the bad category, right? Who's making any policy that benefits you whatsoever? And how often are you being burdened with that policy, right? And so we need to really think about who is fitting in these categories. And what's interesting is, like I said, people move over time. That handout I gave you with the social construction example sort of shows you how it evolves constantly. And we could probably even change it today, right? But we also, what's really useful about this tool is we can look at it in terms of how how we can do this, okay? So we want to talk about the impacts of this, right? And again, I'm not going to cover this entire piece of this, but I want us to look just here at the top. If whether you're advantaged, a contender, a dependent, or a deviant, here's what we're thinking about. Here's the message. What we're trying to say is that your problems, when we create policy, this is basically what happens. If you're advantaged, we say your problems are good, intelligent, important public problems, and the government's going to treat you with respect. And your orientation towards government is supportive. Now, if we look at contenders, let's think about this, right? And again, I would argue that sexual orientation falls here in contenders category, right? Because your messages, your problems are controversial, in conflict with other people's interests, and the government should treat you with fear or caution, right? Do we see how that works out? We see how we can put people in those categories? Again, if you're dependent, your problems are helpless, you're needy, and it's responsible of the private sector. We're supposed to take care of you, and the government should treat you with pity, right? And of course, if you're a deviant, your problems are bad. It's your own responsibility to fix it. The government treats you with disrespect or hate, right? We think about people who would be put in those categories that would get policies that go like that, right? We know that that happens. We know that people get benefits, and we know that people get burdens, right? So we want to be able to think about that when we're creating a policy. For instance, right, if we take a tobacco tax, right, the whole goal of a tobacco tax was absolutely to get people to reduce the amount of smoking. But when you place a tax, if we think about the people who are smokers, right, many, many, many of our smoking people are people in a lower socioeconomic class, right? So what was the burden then? The burden was they didn't get the benefit, right, unless they were actually so burdened that they actually had to give it up. But what we typically saw was that people maybe cut down, but then they were burdened with even more cost when they already didn't have as much money. And of course, we created a policy that was not what we wanted to do. That was not the point of what we were trying to do. We weren't trying to put them in a worse situation. We were thinking of their health, but that's not the way that it came out, okay? So what's really cool is here. Not only can we do it with groups of people, but we can also do it with an issue, okay? We can do it with an issue. So I'm gonna do this. Here's what we're gonna do. I'm gonna show you one, then I'm gonna give you one real quick for your turn, and then we're gonna take a short break, okay? So let's think about immigration. All right, so we have our 4 categories here. And like I said, I'm gonna go through this one really quickly with you, and then you're gonna get a chance to do one real quick on your own, all right? So in this case, we have to think about it. Immigration. Now, immigration, again, one of those big issues that can mean lots of different things to people. So here's what I did. I just came up with 4 little categories, 4 things that could fit, right? But when we think about immigration, who do we mean? Do we mean dreamers? Do we mean people who are legal immigrants? Are we talking about illegal immigrants? Are we talking about small kids of immigrants, right? So if we're looking at this and we're trying to put these into categories to see how we might be helping or hurting them, where do you think these would go? Right, I'll give you just a second. I'm gonna give you the answer to this one. You get to answer the next one yourself, okay? Think about that. If we're thinking about immigration, we're thinking about making policy that's going to impact immigration. Okay, so the advantaged are the legal immigrants, right? People who came here legally, people who followed all the channels, mostly people that are from Europe, right? We saw lots of people over there. Now, it's not that we don't have legal immigrants from all over the rest of the world, but look at who gets those advantages, right? Early on, people who were coming to this country, who came here legally, went through the proper channels, those are people who are advantaged. They get benefits in policy. Contenders, I would argue, would be the dreamers, right? Those are kids who are now of college age and moving into that millennial type stage, right? Who have been here probably since they were too small to know any better, right? Who are fighting for that chance. They're contenders saying, hey, we should get to count because we didn't have a choice, right? And of course, dependents would be our small kids of immigrants, right? We take care of them. We put them in public school systems. Right, we make sure they have vaccinations. Why? Because they're dependents. They're still small children. Even though whether their parents are illegal or legal immigrants, right, we're still taking care of them in that way because they're dependents. And then finally, of course, the deviance in this model is obviously those who come here illegally, right? And we do everything we possibly can to make them not be able to do it that way because they're considered, so they're getting the burden rather than a benefit, right? Makes sense. So this model is really great because you can apply it to groups of people, or to an issue, right? And of course, you don't always have 4 categories. You may be missing one because maybe your policy doesn't have anything to do with kids. But maybe somebody is a dependent in there that may not be a child. Maybe it's a mental health person that would still be considered a dependent. So I'm going to give you, like I said, this example. I'll give you just a couple seconds to think about it. Homeless populations. Now, I'm even going to be nice here. Think about homeless populations. Who, and you're thinking, how in the world could we think about anybody being advantaged or contenders in homeless populations, right? But I'm going to give you the choices. Now, again, I did not include everybody. I wanted to make this relatively painless as we were going through it. Okay, so here are, this time I gave you 6. So clearly some of these are going to be, there's going to be more than one answer per category. So just think about that for a minute. Where would you put these, knowing what you know now, right? Advantaged, contenders, dependents, and deviants. For each of these 6 categories, which one of them would you put them in? And I'm going to give you just a minute. Like I said, if you have a piece of paper yourself, just jot it down. I'm going to poll for this one, and then I'll pull up the answer in just a second. But I'll give you a minute to sort of think, where would you put those? And again, when you're putting these in the categories, it may be a matter of even your own community, right, looks differently. That's a really good way to think about that. Again, and we don't want to think about it personally, because I always make the assumption that for the most of us in public health, our goal is to help the overall population, right? So we're not necessarily, we don't want to put people in boxes, right? We don't want to put groups of people in boxes, but we have to think about it when we talk about policy development, because politicians are, the society is doing that. And when that happens, politicians react to that way and giving benefits and burdens, right? But this might even be changed as we look at what I have the answers here in a minute. This might be changed even in your own community, right? Because think about that, different parts of the country, different communities look at people differently, right? So if you don't get the same thing I get, that doesn't mean you were wrong, right? It just means that where I sit, right? And policy adage is this. This is a really good line for the day. Where you stand depends on where you sit. Okay, so in other words, where you stand on something, where your side of the issue is, depends on your seat at the table. What do you see from your purview? Okay, so let me go ahead to this really quickly. Here's where I would put them. Again, this is just based on my immediate understanding of how we sort of take care of people. If you think about the policy, and again, I have huge homeless population here in LA County. So those who recently lost their job, right? Those are the ones we feel bad for. Those are the ones who are advantaged, right? Those are the ones who we think they could potentially go back to work. So we want to help them get in a house, right? We want to make sure that they don't stay homeless because they couldn't help it. It was COVID-19, right? The contenders would be the veterans, right? They're not advantaged. If you're a homeless veteran, you're not in that group that people are overly looking out for. I mean, look how much trouble we even have with the VA trying to get regular care for them, let alone if they're homeless. But there's that piece of society that says that they've fought for the country, okay? So we can't just throw them out per se, right? So I would argue that's your contender group in this case. Of course, our dependents would be our kids experiencing homelessness, or anybody with mental health issues. That would be those people that we're trying to protect, the most as a society, right? If we know of kids who are homeless, even mental health issues, right? Like not necessarily fault, right? Think about that. When we put that fault word in there, we're starting to categorize people. And then of course, deviants, those are the ones who are habitually unemployed. That's when you hear people talk about laziness, right? Or when you talk about, oh, they're addicted to drugs. If they weren't on drugs, they wouldn't be homeless, right? But if we think about this, we actually can see how the policies are different based on which category you're in, right? And how people perceive them. And this has changed over time, right? Used to be, if we said homeless, everybody was considered bad. They were just lazy. But we have learned to see that there are actually several different pieces to our homeless populations. And I would argue that you could then put them in the categories, okay? So does anybody have a question on this? Because if not, we're going to take a short break. And then when we come back, we're going to do something fun. We get to do a case study, okay? So while you're on your short break, go ahead in your handouts that Emily sent you this morning, and you should have what's called the SSB case, okay, the SSB case. So what we'll do is we'll take a short break, and then I'm going to let you have it like 10 minutes or so, or whatever you need. If you need a little longer or a little less, go ahead and read that case study after you take your break. and then we're going to put you in breakout rooms so you can discuss the questions. So you're not answering the questions yet. I just want everybody to have a chance to read it without having to be in a breakout room with somebody else. But we'll go ahead and put you in one as soon as we finish. So go ahead, take your 5-minute break, and then just be sure you pull that up, that case study, and I'll come back and give you some sort of direction on that, and then we'll move in that direction, okay? Hopefully everybody had a chance to take a quick break and are able to pull up that first case study on what I'm calling the SSB tax, sugar sweetened beverage. So I'm going to go ahead and give everybody 10 minutes or so. If you need a little less, a little more, we'll probably ask you. I'll have Emily send a poll out in, I don't know, 7 minutes or so and see if everybody's done. And if you're not, just say no. We'll give you a couple more minutes before we put you in breakout rooms.
Do you want me to assign them their rooms now?
That'd be great.
Okay, you all should have little invites to rooms. You can join them. I'll keep an eye on it and make sure that you have someone in your room and you're not alone. Otherwise, we'll move you around a little bit. Okay, coffee and donut, I'm set.
Cool. Is everybody else back?
Looks like they're all getting punted back. Here we go.
Okay, you said 53 seconds. I was like, okay.
I came back with 1 second left, so.
Okay. All right, so we're gonna assume everybody's back. Hopefully you got a little something out of this case study and it's made your brain think a little bit. We'll just go over quickly a couple of the questions, just so we have time to get some of the other stuff that we want to make sure we get everything in today, right? And so, and again, hopefully later you can go back and sort of think about it, because what I really want you to be able to do is to start looking through that case again, like if you have some time, and read through and think about what stages of the policy process, like where was there an identification of the problem? How did we start to think about who would get the benefits and the burdens of what policy? What are the differences between those two kind of policies? Like notice they were completely different as far as going on them, right? So if we're looking at the SSB tax, let's go back. Let me show. Oops, I got to click this first. I want to look at oh, there it is. Okay, we're looking at intervention ladder, right? Where does that SSB tax, where might that fall?
Our group said it would fall into number 5.
Right, the disincentive, right?
Right.
Because so we're given that disincentive. We're using the financial or other disincentives to influence people not to do that, right? So when we're talking about the tax, that's where that falls. So, okay, so now we know where that's at on the intervention letter. But if we're talking about the case studies, how are they fitting then into the Schneider and Ingram model? Who are getting the benefits from this policy, or who's supposed to get the benefits? I mean, why would you make an SSB tax? What's the goal? Like clearly we're supposed to be trying to help people from becoming overweight, right? Like to reduce their obesity level. That was, and notice that we identified that really early on in that study for New York, right? Notice they said obesity was a problem. There it is, that's that problem identification. Now, remember I said we had to go to those root causes of that, right? And so we're thinking about that. That's who was supposed to get, again, supposedly, the benefits from the policy, right? Who's gonna get the burden here?
Poor people that can't
Right.
afford it.
Yeah, and even it talked about the beverage people, right, that might lose jobs because, of course, if you have to increase it, your sales are going to go down, and then we might have to lay off people in the process of that, right? And are we really thinking about that? And notice politicians, their number one goal is reelection, okay? Number one goal for politicians, I know that sounds terrible, but it's actually true. So number one goal is reelection. And so anytime that you're talking about job loss, economics, so you notice that those lobbyists are powerful people, right? That's a lot of money spent on those two cases that the American Beverage Association was throwing at people, right? To make sure that they didn't lose any skin in the game, right? I mean, that was the whole point here, was that they wanted to come out on top. Now, of course, we saw that they didn't necessarily come out on top for the seconds of it, right? But what do we think about an SSB tax? Is that okay? If we're using it, like I said, SSB tax has been around for a lot. Soda tax, period, has been around for 100 years. So is it okay to use it as a revenue generator? Just the tax itself. Do we think it's okay just to have a tax?
Yes.
Our group thought so.
Yeah, it is, right? Because I mean, we've been using that. But now, what about if, as a public health initiative? Are we okay with that?
We do it with other things like cigarettes or alcohol. In some
But we're
cases.
learning that that hurts people.
Yeah, it disproportionately affects specific populations.
Right. And here's the other thing we have to think about. If sugar beverage was the only thing, the only causal pathway to obesity, right? Then we might be super justified to say we gotta go after this, right? But is that the only influence on obesity? So the question we have to ask, and again, there's not necessarily a right answer here. The question you'd have to ask yourself is, are we gonna get enough of a reduction in obesity, right? Is it really gonna help enough for us to put those people in a burden to pay more for their soda, right? So that's that trade-off. Remember those ethical questions? Do the benefits outweigh the burdens, right? Are we giving this population so much of a burden to charge them more tax? And are we actually really improving the obesity rate? And if we're not doing that, then should we be doing the SSB tax, right? So, I mean, that's, again, these are just meant to make you think, oh, well, wait, unless we can show that we actually are getting this desired outcome from this, and it really can contribute to the SSB tax, then we should not be burdening that group of population in the past for that, right? Okay, so there's number 4, there's 2 reasons the portion cap rule did hold up to court, right? The first was that the public health department had overstepped, they did not, overstepped their authority. What could have been done instead? So they went outside their authority, right? They didn't have the legal authority to do so as the public health department, but who could have done that? Maybe the city council, right? Like if we're talking about New York City, right? If it had been legislatively passed, then there would be a difference because, again, we still might come back to say, okay, who's being restricted? Is it arbitrary type thing, right? Or they could have actually done where they were more like Philadelphia and included a wider range of beverages, right? So that might actually be a case. And it's interesting because what we see here, and I'm going to click through because I want to show you a couple things. So you guys looked at New York and Philly. So what we saw happen, because other places were trying to do that, right? So Philly was going one route, right? Their whole argument was that, and of course they had the court case to go with it, right? Argued it was a double tax, went to the Pennsylvania Supreme Court. But in New York, they were trying to ban, like they were limiting your choices, right? They were restricting, you couldn't have a beverage more than 16 ounces. That wasn't even a you pay a tax or you get a fine, you just can't, right? So see the difference on that intervention ladder of where you're at with tax versus where you are with the ban, right? So it does make a difference. And again, it also makes a difference as individual liberty goes and who gets the benefit and who gets the burden. So, but it's interesting because another thing that we see, look at this. So in California, okay, because this brings us back to the idea of preemption. There were bans in Oakland, in Berkeley, and in San Francisco. So the city took it upon themselves because we didn't have a soda beverage tax in the state of California. So the cities are like, okay, well, we're going to pass one because you don't have that. You don't have a thing that says we can or we can't. So we're going to do that. We're going to think about that as there's nothing here, so there's no floor or ceiling when it comes to SSB tax. Well, as soon as that happened, of course, here comes the American Beverage Association, right? And convincingly, they convinced the state legislature. They did not strip Oakland. They did not preempt Oakland, Berkeley, and San Francisco of their power. But what they did do was create new legislation that said no new soda taxes. Yeah.
Oh, we can't see your screen if you started sharing again.
Oh, you can't? Okay, thank you for telling me. That's interesting. Oh, I think it's because of the breakout room. It's probably when I went to the breakout room, it doesn't let me, you know what I mean? It takes it from you. Here we go. Thank you.
Yeah.
Share. There, better?
Yes, thank you.
Okay, so again, California, like I said, they put in that city ban because there wasn't a floor or a ceiling for the state of California, or for the federal government for that matter. But instead of preempting them and taking it away from them, they just said no new soda taxes until 2031. Okay. So we do see that there are differences in how states and local governments, right? Philadelphia is the city, New York in this case was the city, California was the state that came to preempt those cities that had passed their soda taxes. So the whole point of this is to think about, like, who is getting the benefits, who's getting the burdens, where are we at on that intervention ladder, who's involved? Is it actually the health department trying to make a decision? Do we have the legislator involved? It's really interesting that we just looked at that Schneider and Ingram thing with the immigration, because as you guys were in your thing, I saw on my phone had passed up from the New York Times saying that the Supreme Court just ruled that President Trump can't single-handedly were brought here, or that Obama signed as an executive order, and Trump said he would get rid of, right? Well, now here's what's interesting about that. So remember, I considered Dreamers in the contenders, right? So clearly they were on somebody's radar, right? Because the president wasn't allowed to just get rid of it, because the court could have easily ruled that, okay, it's fine for him to do so. But instead what they said, now they didn't rule on his policy yet per se. What they did say was that he didn't give enough evidence, right? Because they're in that protected class. Think about that. Think about that strict scrutiny that he's going to be under to be able to get rid of this, right? For that group of people that is considered those kids who were brought here when they were children illegally. Okay, so we are in our seat, we just saw it today, so how fun is that? All right, so everybody basically hopefully enjoyed that case study a little bit. We do have one more, so I want to get us through so we can finish it. The next one is actually really fun, just because I think most of you will enjoy it because it's from Montana, so we've got a lucky one there. So let's go on to the next part. We want to recap this. So we've spent a long time today talking about government interventions versus individual liberties. How about what ethical things we need to consider? Remember, that's really the benefits and the burdens aspects. Those social constructions that Schneider and Ingram have helped us sort of look through, and remember, we can do that for both issues and with people, right? Who's getting the benefits and who's getting the burden? And are we actually getting the benefit more than the burden, right? Where are we on that intervention ladder, and are we going to be justified legally by the judicial system to be able to say we did that, right? So now we know why, but how? How do we do this, right? So of course, 6 steps in policy development. This is interesting because the reality of this is that we've been talking about this all day, right? So this is just sort of a little bit of a refresher as we get to the next piece to make sure we're all on the same page. It sort of talks about it just a little bit differently, just so we can think about it maybe a little more scientifically, right, as far as that goes. And of course, we always, in this section, we're going to talk about the 6 steps in policy development. We're going to talk about how to engage stakeholders and build momentum, and then we're going to talk about that built environment case study, okay? So policy development, back to that, define and understand the problem and its causes, right? We want to make sure you're understanding what that issue is, and not only do we recognize what the problem is, whoever gets to define it wins. Think about this. When we talked about global warming, right? All anybody had to say was, it's colder this year than it was last year. And global warming was sort of thrown out the window, right? Once we got to switch that definition to climate change, people take it a little bit more seriously, okay? So defining, not only knowing what the problem is, but whoever the definition wins, right? The next thing we want to do is like clarify which of the causal or contextual factors are the most apt to change, have the greatest scope for change. Where can we get in there and make that change? And of course, to do that, we want to make sure that we're using data, right, if we possibly can. What have we seen work and what are we seeing that doesn't work? So then we have to identify what's that change mechanism. What are we going to do? Is it going to be a tax, right? Is it going to be, you know, we're going to offer something to someone? Are we going to open a new program? Are we going to get people into housing? Like, where are we going to do that? And how are we going to deliver that change mechanism? So think about, are we here? Do we need to get involved in more than one place, right? More than one place. So honestly, when we're talking about these different ones, right, it's easy for us to go, we want to test and refine them on a small scale and then collect sufficient evidence for their effectiveness, right? And I'm going to look at a couple of these just by themselves because I already talked about this piece of it. So I'm going to scooch through here because I want to know the greatest scope of change. What system is this part of, right? In this scope, is this a primary prevention or a secondary prevention, right? Are we talking about limiting smoking? Are we talking about what are we doing for people who are already smokers, right? Where are we at? Which is the mechanism that we want to do? Because if we just want to reduce smoking, how are we going to do that? Which of these places do we need to plug in, or does it need to be more than that? And the reason I'm asking that is because that change mechanism, we can actually use program theory to do this. And I've included this theoryofchange.org. This is actually really great. There's some really good examples on there. For instance, there's one called, I think it's called Superwoman, and it's a program to help. It's a program, not a policy, but it is a program to actually help battered women who have been victims of domestic violence to get back on their feet. And what they do is they show you how you can use theory of change. And really, it's a lot of backward mapping, right? So here's our end goal, and how do we get there? You can sort of see how you can use those change mechanisms. What levers are we going to pull? So when you get some time, check that out. And of course, we want to involve the stakeholders, right? As when we're moving through this, how are we going to deliver this? What's the change mechanism, and who's going to be in charge of this kind of a thing, right? And then I want to just jump to the next piece, because this is going to come into play with our last case study, is testing and refining on a small scale. And we don't always have the option to do this, but anytime that we can sort of do like a pilot or a test run for the thing that we want to do without overhauling it into everything, right? That helps us out tremendously to be able to see if we're getting where we want to do, because at the end of the day, right, if we haven't talked about who's going to deliver this, who's going to reach it, who's doing the job, right? If we don't have that evidence, we can't justify implementing it on a wider scale, okay? We can't do that. Okay, so let's talk for just a couple minutes here about engaging our stakeholders, right? Because this is really important for us. As I said, here's how we do this. The first thing we want to do is this. We have to identify who they are. Well, that makes sense, right? But they might be individuals or groups or whole organizations. So we have to think about it. We want to cast a wide net. We do not want to miss anybody. We specifically do not want to miss those negative stakeholders, right? And then the next thing we want to really do here when we're talking about stakeholders is this. Who are they? Who are they? Because if you can't analyze and understand who they are and what they're bringing to the table, right, you can't really engage with them. We can't just be like, oh, these are the people that should be involved. We need to get to know who they are, what these organizations are, why they care about this issue. Why are they stakeholders, right? Now, hopefully when you're developing policy, you have a team, right? We're hoping that there's a couple of you working on this situation so that you can really see that and be able to allocate your resources accordingly. So you want to do that. And the way to do this is to come up with a plan. So I've talked a little bit about politicians today and how they're trying to get the things through that they can to get reelected. This, when you're trying to create a policy, you are in a campaign of itself, okay? You're campaigning to get to your outcome, right? And this means planning. What is the message you're going to give to these stakeholders? How are you going to get them involved? How are you going to get everybody to sort of see that message the same way? And once you come up with that plan, then you have to act, right? You need to go move. You're going to get resistance. You need to decide how you're going to take that, right? When a negative stakeholder comes throwing something at you, now hopefully in your plan, you've thought about what that negative is going to be, and you're able to have a good response ready to go. But almost always, think about this, you bring up a new idea and somebody shuts it down and you look at them and think, I didn't even think about that, that's insane, right? Or what? And if you react in a negative way, you're never going to get that stakeholder off. So what is your process for when you act? How are you going to take in information that you weren't expecting to get and then come back down and sit down? And so you need to plan through these things. And when you go to act, like I said, you got to think about it. And then when you come back, you really want to be able to review. You want to think, okay, is this where we thought we would be? Because stakeholders are going to come and go throughout the policy process. Some of them are going to be there the whole time. Some of them are just going to be there for the problem ID. Some of them are just going to be there to help through the legislative process. So think about that. Are you really engaging with people in the way that you thought you could, right? In the way that you thought you could. So influencing strategy, right? The big three emotions. So a lot of the people that you're going to deal with are going to be business people. right? Because even though you're all in public health and you're trying to do public health policy, think about this. If we're going after, like, let's say e-cigarettes, right? Like a potential, we want to decrease that, right? The business owners are the ones who are making the money off of this, right? Of selling this. So you're going to have to be involved with them. And so part of creating your policy and selling that and engaging, because they're stakeholders, and again, they're against you at this point, right? They don't necessarily care about your public health stuff because it's going to cut down on their money, right? So here's the big three emotions that we can think about: values, desire, and fear, okay? So business people almost always will tell you about their business values, right? Think about this. Our family-owned business has been here since this. We provide blah, 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 right? So if you can align your proposal and you can say, oh, that fits with what we're trying to sell here, right? You make it harder for them to reject you. Desire, this might even be greed. This is called the wham factor, right? The what about me? So even if the policy is not going to give them a benefit or the burden, they still want to know what's in it for them, right? How can they further their career, or better serve their customers, or strengthen their network, right? And of course, fear, we have to be careful because we don't really want to use fear if we don't have to, right? And really what we see is that we actually just have soft power, right? Soft power. It helps us to shape our stakeholders' perceptions and opinions, and it reinforces supportive perceptions and opinions, and helps us really to shift critical perceptions and opinions. So I think we have, like, there's four basic pieces that we can talk about, and one of those is our reputation. You know, you have that reputation as a professional, and if you can show stakeholders, you can show those people in your community that you know what you're talking about, you're going to have a much better chance of reaching them, right? And then attraction. 3 things attract people to you. Charm, if you're likable, right? Do you smile? Are you out there? Do they see you? Are they familiar with you? We like people that we know, right? And more than that, are they similar to us, right? So charm, familiarity, and similarity, that's what attracts people to you. And the greater you can do this, and of course, this is by coffees and meetings and phone calls, right? This is where you hope you have a team to help you out. The next thing is motivation. That's a source of soft power. So there's 4 types of motivation, but only 2 are used here in soft power. People really like to be part of a group. So we have that in social motivation. If they feel like they're on the outside, it's a better chance that they want to move on the inside, right? And then there's that intrinsic motivation that basically says, hey, I want to be part of this process because I don't want to feel like you took my power away. Okay, so we want to make sure anytime we can motivate somebody socially or intrinsically, that's just a form of soft power because we're not making them do anything. We're giving them, you know, those options to be part of this group. And of course, in relationships, always important with stakeholders, and that takes time. Relationships take time, but it's worth it in the long run if you can build up those things, right? You can build up those relationships. We can get in there and they're going to help you to build other relationships, right? And again, hopefully you have more than one person working on this policy development, because if you do, then you're able to actually get in there and work with them. Okay, so now we've done all these things, right? We've done all these things. So we only have one more thing to talk about, and then you get to finish up your last case study, and then we'll be done for the day. But when we thought through the policy process, when we've decided what the problem is, when we've looked at the policy options, when we've thought about our legal standing, when we thought about what levels of government this has to come from, when we know who the stakeholders are, when we figured out how to use our sources of soft power, when we know where people go on the social constructions table, we've done all of these things. Now we're ready. We're trying to get to that. Remember that policy window we talked about at the beginning today, where those 3 streams have to come through? At some point, we have to get enough momentum to get it through that window, okay? And so there are just a few quick, easy things that we can think about. How do we build that momentum, right? We have to communicate the why. Why do we need this change? What's wrong with keeping in that same regular thing we've always done here? Who cares, right? All of that, explaining how those will benefit your individuals and your communities is critical, right? If you can tie that benefit to something for this community, you can actually do that. People start to get passionate about that. They want to help. If you can come up with a catchphrase or a line or a tag that says, oh my gosh, let's go to this. And then of course you have to stay the course, because if they start to see you falter, you're in for a very tough time, okay? The second thing is it's your job to paint the picture, right? What are people moving from and moving towards? Nobody, I mean, honestly, let's think about this. No one really likes change, right? It's so much more difficult to get people to change. So you want to paint the picture of why. What is the difference? How big is the gap? If we're here and we want to get to this next level, how much of that, right? What does success look like? How much are they going to have to actually put in? I mean, if you're going to make me make a change, am I going to have to learn how to walk? Am I going to have to learn how to run a marathon? Or do I have to become a triathlete? Think about this. No one wants to have to be a triathlete. So if you could paint me the picture that shows I really just have to take a few steps, setting some sort of reasonable expectation, once people realize they're up to that task, right, it moves them forward. And then they get excited. Again, common focus, team focus, it's a goal. Of course, how are we going to get there? It's your job to be the guide. I mean, if you're really involved in this policy development stage, right, if you're designing policy or you're pushing for a policy, you need to guide the stakeholders through what that means. You cannot take for granted ever that they understand completely what it is, where you're going. You understand that, your team understands that, the people who are working with you on this policy issue, but not everybody understands that. So somebody has to guide them through that so they understand. Of course, then you're always going to get resistance. Nothing ever goes through, right? Two things about policy. There's always going to be a burden and somebody's always going to push back for some reason, okay? You know it has to be. So you want to make sure that you're prepared for that, okay? You're going to have to prepare for this so that when it comes up and it pops up, you can have people go straight for that resistance and see what you can do, right? And you need to acknowledge and celebrate milestones, right? At some time, maybe it's the baby steps along the way that actually are worth it, right? Maybe it's those times when you got one more legislator to say that they might actually care about this, or that they might vote for this, or that you saw the city council maybe is not resisting as much as they used to be. You've had a change in council members and yes, now you didn't get it passed yet, but you saw a change, right? So if you want to keep the momentum going, you have to keep that positive stuff coming. You want to decrease as much negative as you possibly can and celebrate those milestones. And again, the policy process is long, right? It's just long. And it takes too much time and it's frustrating. So keeping the momentum going is the most difficult of all the pieces, right? Because you have to be the cheerleader. Whoever is creating this policy has to have enough to keep it on the agenda, to keep people passionate about it, to keep people moving forward. So again, celebrating milestones helps us to do that. And most importantly, you have to manage yourself. How many of you, I already know the answer to this, it's all of you, work too much and too hard with few resources and limited time, right? So the problem is this. Nobody's going to want to think about it. Do you want to listen to somebody talk about something who seems exhausted or stressed or overburdened? If you're responsible for leading the change, right, you have to start by getting your own house in order, right? It's necessary, but you need to take breaks, right? Honestly, if you're trying to build momentum, everybody's like, I can't stop, we have to move. No, because when you get too exhausted, when you're too tired, when you have given everything you have, right? And this is where you hope that you're working with a team of people that's trying to keep the momentum going so that somebody in your team can look at you and go, you need to take a break from this because you're not going to help us if you're not okay, right? And I think we too often just keep going until we just fall down, right? We really can't do that when we're trying to keep the momentum going, because when we look exhausted, everybody else who's been part of this policy process is going to look at us and go, yeah, I'm tired too. And then we lose it. We lose all that steam. So really, if there's an issue or an area that you are so passionate about, that you know there can be policy change, whether it's at the federal level or the state level or in your own town, right? You know, I really hope that after today you'll understand the importance of how much, A, the need for public health people to be involved in this process, and two, that it's not easy, and that there's going to be a steep learning curve, right? You're going to have to really work it and get comfortable with people who know some of these pieces to help you out. But really, again, it's so worth it in the end, right? Think about if that one public health issue that is really detrimental to your community, what if you could go to work on that? What if you could actually come up with good public health policy that made a difference in that community, right? We're going to see how this sort of works out. Okay, so all of you should have what I'm calling the Tobacco Free Parks case study. And let me just say here, so before you go off to read it, again, this one, it's a little longer, but not, because it's not two separate things, it's one thing. And a lot of you, I'm sure, are familiar with tobacco-free parks and initiatives, right, living in Montana. Part of that built environment type change that we would like to make. But I wanted to be sure and give plenty of credit for the information in this case study. So this information in the case study was actually submitted in 2 separate assignments by a student of mine. Her name is Heather from the My Health Policy course this past spring. What was really interesting in this case study was this. She turned part of this in as a policy brief early in February. And I was interested because I saw she was making some movement on this, and I have had other students wanting to make the same kind of changes in their community. So I was interested in where she was getting resistance, if it was working, that kind of a thing. Well, so she gave me some information. And then as we progressed through the semester and I was looking for this and thinking about something we could use as a case study to look, some more information came up and she turned in the second piece of it. Well, once she did that, I realized that thinking about all the things, and this is what I want you to think about when you're reading this case study. What's the problem? What's the policy? Who's going to get the benefit? Who's going to get the burden? Where is it at on the intervention ladder, right? Who are the players? Who are the state? Like, as you're just reading, like, hopefully it starts to jump out at you a little bit. You can go ahead and scroll down, I would suggest, and read what the discussion questions are going to ask you at the bottom, just so you sort of know what you're looking for. But really the big piece of this case study is to sort of see how it all comes together. This case study is a really nice reflection of all the different places that we've talked about today. In policy development, who are the stakeholders? What about momentum? Think about momentum as well when you're reading through this case study. So go ahead. What I'd like you to do, again, she was nice enough to give me both pieces. What I did was cut and pasted from her 2 things to give you this sort of case study that gives you the backbone of what it is. So go ahead and take a couple minutes, a few minutes here and read that, and then we'll talk about that. So read, read, read. Once you guys are finished reading through this, go ahead and just jot down that, some ideas about what might answer those questions. So, since we're on time constraint here, we want to make sure that the most important part for me is that you get to read through it, and then we can start to think about, and I'll give you some pointers of things to think about as we move, because you can take this with you. So you won't have to go in a breakout room, but if you can come up and think about it, answer some of those questions quickly, like where do you sort of sketch this out as you're finishing up reading? Yeah, we're just really, like I said, we're just gonna we're gonna sort of walk through this a little bit. I just wanna show you and how we can sort of see it, I'm hoping anyway, right? As we come along here from these kind of pieces. So if we go back to the beginning, right? So basically in that first part, right, she's giving us this background information, which, remember I said, if we're going to make some sort of policy change, we want to have as much data and information as we possibly can, right? So she's also making a really good argument here that this is the leading cause of preventable death and illness at the global, national, and local level, right? She goes in to discuss a little bit more than that, but notice at the beginning of the next paragraph, right? She says, despite substantial progress, smoking remains the leading cause of morbidity and mortality nationwide and in Montana. 2 things should stick out for you here, right? A, she's identifying the problem, smoking, identify the problem. But look what she's doing. She's saying the leading cause of, morbidity and mortality. Remember we talked about the ethics, we talked about standing up in court and who has authority to actually pass public health laws. Why do we do that? Because if we're attacking something that has to do with morbidity or mortality, we have a better leg to stand on, both ethically and then also in a court, right? So there it is. She's already giving us that piece of it, okay? And so then as we start to scroll down again, more data, she's talking specifically about what's happening related in Montana alone. And then she moves into the county, right? She starts talking about that community health needs assessment. And a lot of times that's what we have to do. Sometimes during that policy process, remember when I said we sort of had to evaluate, remember the early policy process that we've already talked about, and how the CDC put that evaluation all the way around the circle. So one of those types of things would be a community health needs assessment. That's an evaluation to sort of see that now she's got data to say there's a higher rate of smoking, right? So that's alarming. Great. So now tobacco, she gets to the part where she tells us that it's increasing for youth, right? The Youth Risk Behavior Survey didn't give us some very good things, right? So, okay, now we know that this is a problem. We've established it. We've established that there's some authority here because it's an issue in Montana, not to mention the rest of the country, but it also is a morbidity mortality issue, okay? Now, if you look at the next part where she talks about interventions, notice here that they're not going after smoking totally, right? This entire intervention is not about no smoking ever, right? It's not about taking all that, it's eliminating choice, it's totally gone. So if we're thinking about intervention ladder here, first of all, we're not that high up. Second of all, if we're talking about this policy is just a piece of it, right? It's addressing one of these root causes that goes to that piece, that overall to decrease smoking, right? So this is what she's first telling us here. This also, again, notice her first line here, a proven intervention strategy, okay? What did I tell you earlier? I said we don't want to reinvent the wheel if we don't have to. Do we want to start from scratch, or do we want to show, we want to be able to tell people, convince people, engage these stakeholders and build momentum by saying, hey, look, this has been used before and it works. We don't have to start from scratch to create a policy that does this, right? So if she looks at this, she goes in to tell us what a big deal it is to have the secondhand smoke and how much it actually even is detrimental when we're outside, right? So that's a really good selling point. That's that message. When you want to package the message to stakeholders, part of that is what she's doing right there, is explaining that while we all understand secondhand smoke in the house, what does that mean when you're outside, right? Because people are like, I'm outside, what's the big deal? There's that part of that messaging, right? And she gets through that in the next paragraph when she's talking about, furthermore, people who use tobacco themselves are not excluded, rather the exclusion is the act of smoking and vaping. So notice here that she is talking to us about who's going to get the benefits and who's going to get the burdens, right? She's basically telling us, look, these kids, people who have disabilities, people who have asthma, who are children, when they're coming, they can't come to these parks if they're smoking there, right? So tobacco-free environments actually let them in. So all of those people are going to get the benefits. And who's going to get the burden here, right? Well, the burden's going to go to those who are smoking, right? But is it such a burden? Because it's not telling them they can't smoke anywhere. They just can't smoke at the park, right? So they have to go, if they're coming to the park, and again, you could choose to come to the park or not come to the park, right? But if you chose to come to the park, you would then have the burden of not being able to smoke while you were there, okay? And then if we're weighing the benefits versus the burdens, think about that as we start to think, oh, look at all these people who can benefit, and really is the burden that high? No. I mean, as far as individual liberty goes, if we're talking about community action, if we go back to that social compact theory that says all of us are somewhat responsible to one another for the health and safety of the whole community, doesn't this fall right in line with all of those things? Right? So then if we start to move down here a little bit more, right? She says, right before the environmental impact, she's framing this on how to present it, right? Tobacco-free policies support a normative message that tobacco use is unhealthy and undesirable to individuals who do not use these products and is not the social norm, right? She's framing this issue. She's showing us how do we get people on board with this? How do we get people to move and make a behavior change, right? How do we get people to be passionate about the fact that we should get this policy through, right? And she's also framing this as far as environmental impacts go, right? This is a really good way. This is the what about me factor, okay? So she's talking about how much trash, how much decomposition. Think about all these things. So even if you didn't think you were involved in the whatever, I don't go to the park, I didn't do this, but maybe you have an environmental component, or maybe even some of the smokers have an environmental component, you know, and they feel bad that all those things are happening at the park. And so even then you could convince them. So she's giving you different frames, right? Because you know you're going to have different stakeholders and you need to get everybody on board one way or another, right? Okay, so if we jump down to that next section that says tobacco-free parks, she tells us legally federal and state laws in the US allow for local governments to regulate tobacco use in outdoor environments, including parks. So she has that, right? She's let us know that preemption is not going to be a problem, right? So that's the whole point of it. She's thought through the process of how do we get to have this? And clearly she's cited the Public Health Law Center here, right? So fines or penalties can act to strengthen the policy, but it's primarily dependent on social enforcement. And there is a distinction she lets us know here, right? It's this voluntary type of cooperation. So there's a difference between a resolution and an ordinance, right? In both cases, we're asking people not to smoke, it's prohibited, but resolutions typically rely on public cooperation. That's that voluntary power, remember? Whereas that if you have an ordinance, then there's policy language has to be articulated to include your alternatives and what you're going to be using for that. I do like that she includes the cultural considerations, right? Especially when you're talking about tobacco use. We have to be really careful that we're not going after a particular culture when we're talking about these things that are used for ceremonial or spiritual matter. And we have to make a huge distinction, right, between commercial tobacco and otherwise not, right? So in accordance with this, we need to, again, when our policy is created, we need to think about those things, right? And then as she moves through this next section, she tells us this is a really great opportunity for us, right, to have a positive impact on the health of this. And so she talks about this, she says the CDC lists tobacco-free parks as a best practice, right? Intervention strategy. So in that policy development stage, do we have data to back this up? Yes, we do. It's a best practice, right? And then she goes on to tell us, remember from the very beginning of today, she said these policies are almost exclusively enacted at the local level. Oh, see, there's those levels of government. But she tells us success in 11 other municipalities indicate it would be what? Feasible, okay, right? Because remember, we want it to be efficient, effective, equitable, but is it feasible? And she's showing us here how, wait, it's been done in 11 other places, right? So I hope you caught that when she said, it's feasible to do it here, right? What does that mean for us in the long run? So of course, this tobacco-free parks, if you go to the next section, she says, armed with all this information, a tobacco prevention coalition comprised of who? Look at all these stakeholders, policymakers, park staff, partners in public health, parents, and other community members was formed, right? So she's including stakeholders here, and that is a wide-reaching net, right? She also had existing partnerships with the City Parks Department and the City of Bozeman staff. Again, there's that feasibility, right? And in the next paragraph, she even actually says that they're going to gather qualitative and quantitative data. So you're gathering that data, that's part of that policy development thing, and to say, hey, what are we doing here? So then she goes on to highlight what kind of data that they collected here, right? And then she says, finally, there was a survey distributed, again, with the stakeholders. You're talking to the residents of Bozeman themselves, and these are the smokers and the non-smokers. So you've got who could potentially be negative stakeholders involved in your survey, which is great because that means she didn't leave them out, right? She didn't leave them out. So notice that is a really big deal here, right? They didn't leave out those smokers. They didn't just ask the people who wanted a healthy Bozeman, right? They asked everybody. And what they found was the results, approximately 12% of the respondents indicated that they were current tobacco users. So that means they actually got a good sample, right? So then what they were able to do, looking at the amount of partners, watch this. Here's that pilot project, right? It's number 5 on that development part. If you can do it, right? It was a little more palatable, a little more feasible to start small and then see if it was working, right? And then to see if it's working. And look, as they were doing this and they started to roll out this campaign and people were doing, other strategies were used. There's that momentum, right? There's a Facebook ads and Instagram posts and t-shirt contests and health fairs and letters to the editor. Oh my goodness, look at all the partners, look at all the stakeholders that are coming together here that are actually helping to build momentum for this and to keep it on people's radar. Oh yes, we have these 2 parks, right, that have this tobacco free. And then they started to think about this. They went back and they did follow-up data, okay? Went back and did the follow-up data. So now we have actually gone through all of these stages. And so with the promising results in the pilot project, right, it was time to think about expanding it to the rest of the parks. So one source of contention was to keep a resolution or to move to the ordinance. There's that policy analysis. What are our options? Do we keep it here or do we move it up the intervention ladder to here? Right? Are we asking people to do something voluntary? Are we asking somebody to do mandatory? Or are we asking somebody to do something compulsory? Right? So she's weighing those policy options. So of course it was determined at that time they didn't have time or the resources to run around, you know, actively enforcing it as an ordinance. So they decided to pass a resolution. Okay. Resolution. And notice that the Parks and Recreation Director was also on the Bozeman's Recreation and Parks Advisory Board and was a member of the Tobacco Prevention Work Group. This is a key stakeholder right here. Notice, because this person has all these people that he can come in contact with, that he can make this work for us, okay? And then finally here, notice she's not reinventing the wheel. They're using what Helena had already done, right? It was already there, already passed a resolution, did not start from scratch. Of course, here comes COVID-19 to get us down at the end, right? Unfortunately, due to the coronavirus, adoption of the resolution has been delayed. So the only thing that I can see in this, right, where they really are having this issue is the idea of building momentum, okay? Because it was there. They were right there. If they could have brought that resolution to the meeting the next time like they were supposed to, you know, she knows she had support from 4 of the 5 commissioners. There was it. Now it's been sitting since March, right? So that would be the only piece of this at this point that might take a little more back to the, we got to get back in there and pump this up, okay? So hopefully, like I said, as you look through this later, you can actually even start to think about, oh, I am seeing that those pieces are starting to fall in place. And that, again, is a true story from there in Bozeman, okay? So hopefully you've enjoyed that piece of arguing things. So just quickly, again, we're in the intervention ladder, making healthier choices the default option. If we moved it to an ordinance, we'd move it to regulate or limit choice altogether, right? This is a voluntary power because they didn't go to that next level. Of course, we talked about the burdens of the smokers and the benefits, you know, too many benefits definitely outweigh the burden. But this also goes through those 6 steps of policy development. Again, the only thing I would argue is that maybe the momentum is going to be an issue at this point just because they didn't get this stinking thing passed before COVID hit, right? Stakeholders seems like they did a really good job with having the work group created at the beginning to actually be able to include a whole bunch of stakeholders and people, like I mentioned, the super stakeholder that was involved in several aspects of this. So really that, I mean, again, this is an excellent case for what we covered today to show that. So hopefully you've enjoyed that piece of it. Does anybody have any questions? I know we're right at time, so.
Amy just had a comment in the box, the chat box, but.
I can't see.
Oh, she just
I
said.
mean, I can't, it's not, go ahead, read it to me. Thank you.
She just says, I thought it was super cool that the health department in Bozeman did mixed methods study about public perception and enforceability.
Exactly. I mean, it's like, I mean, this, it could not be more perfect to have used as a case study. Like I said, fortunately for me, Heather did all the work, right? She put it all together, but she was working on it. I mean, this was her, she's one of the players. Again, she wasn't doing the whole thing by herself. As a matter of fact, it was a 5-year deal. She's only been in on that for like 2 or 3 years. So she even came in, new players are coming and going all the time. But I do think it's great because they were able to use that survey component and then they went out and collected stuff. Like there's no arguing that people supported this and that they could make a difference by doing that, right? So, and anytime you have that, like it's really hard. But again, who are the people voting for the program, right? If you had that whole council that was smokers, are they going to vote yes or going to vote no, right? I mean, that you're still going to hit that roadblock at the end of the day. So, other questions? Well, I've had fun today. I hope all of you have had fun as well. I'm going to click to this next screen that I know that's just the references and resources. So all the things that I've talked about today are here. And I know I didn't bring up the Superwoman example. I told you that on that theory of change, but I did go ahead and put it here. So like I said, you just go to theory of change and it's one of those Project Superwomen. And then I know Emily has this for you if you guys would fill out the evaluation. She's going to post it, I think, here in the chat box. And also it'll be emailed to you. So please take a couple minutes. They're pretty quick. Emily doesn't send you through the ringer on the evaluations.
I try to keep them simple. Yeah, you will get that emailed to you this afternoon. And again, the recording of this will be available. And then of course, Trisha's information is there if you want to ask her questions directly.
Absolutely. And any of you who are going to jump into the policy process, you want to talk about it, you just send me an email, okay?
And as always, if you have any questions or concerns or anything about the training center, certainly give me a holler. And we hope to see you at another training in the future.